Thank you, everyone, for being patient. We have a full afternoon ahead of us. We have Senator Utke, Senator Abeler before us. Thank you so much, you guys, for being here. The plan is to hear Senate File 4190H, which is the HHS bill, Senator Utke's bill, and then we'll move to Senator Abeler's bill, 4165, the policy HHS bill, and then those two will be combined and sent to the floor. So that's the plan. But we will start at this point with Senator Utke and 4198. Welcome to the committee.
Thank you, Madam Chair and members. I will go quickly through some of the content that's within Senate File 4198 for our HHS Omnibus bill. This is the Omnibus Health and Human Services Policy and Finance Bill. It contains forecast adjustments and other bills that reflect priorities of our committee. Some of the priorities include interstate compact agreements for nurses, counselors, and speech language pathology. Other highlights are streamlining fingerprinting processes for licensed individuals and creating a 90-day temporary permit to practice medicine in Minnesota to ensure new hires can become eligible to work quickly. This bill modifies requirements for the operation of groundwater thermal exchange devices by establishing a new definition in statute for a submerged closed-loop heat exchanger. It also establishes a second set of construction standards for a water supply well and excludes the use of various processes for the evaluation and submerged closed-loop heat exchangers in a specific manner. The bill keeps us up with the current technology that can achieve the same results as geothermal, but with a smaller footprint. Adjusted the notice required for hot tubs at standalone single-unit rental properties. This language would exempt standalone single-unit rental property hot tubs that are intended to be used by occupants of a rental property from the requirements of a public pool. This is intended to help small family resort owners to comply with the VRBO, or to compete with VRBO and other home rentals that have hot tubs as an amenity. We are following, we are allowing designated critical access hospitals with attached nursing home to adjust their bed usage up to the maximum of 25 licensed beds in the hospital. This will allow hospitals to have swing beds that can be allocated as either hospital beds or nursing home beds and can be reimbursed through Medicare accordingly. We have 11 of these small publicly owned hospitals currently, and this will help them survive and continue to serve their communities. This bill also exempts Children's Hospital in St. Paul from the hospital moratorium and allows 22 pediatric inpatient behavioral health beds to be added. This will allow Children's Minnesota to increase access for mental health care for kids. This bill temporarily modifies the staff and operational requirements for emergency medical services until January 1st, 2024. The EMSRB has a new executive director and needs time to assess and recommend changes, including those that are from the Office of Legislative Auditor. The OLA released an evaluation of EMSRB in February of 2022 with recommendation for significant legislative changes and for the EMSRB board. An annual report request under dental utilization. It requires that the annual dental utilization report beginning in the report due March 15th, 2023. The Commissioner of Human Services is required to include certain information regarding the number of dentists enrolled as medical assistance providers and the number of enrolled dental providers who provide dental services to enrollees receiving services through the fee-for-service system and under managed care. These reports will be given by congressional districts. Health-related licensing and scope of practice, making a number of adjustments and changes to this section. Changes the scope of practice for pharmacists. It allows pharmacists to order tests as part of the monitoring drug therapies and administering vaccines. It also authorizes pharmacy technicians and pharmacist interns to perform lab tests and administer vaccines. If certain requirements are met, and the technician or intern is directly supervised by a pharmacist. It also requires MA to reimburse vaccines and lab tests at the same rate as another practitioner performing these services. This bill also creates the Nurse Licensure Compact for registered professional and licensed practical nurses, creates an audiology and speech language pathology interstate compact, creates a licensed professional counselor interstate compact, creates a 90-day temporary permit to practice for physicians and physician's assistants or respiratory therapists. It also extends a temporary permit issued by the Board of Nursing from 60 to 90 days. This bill will help ensure those who come to Minnesota to practice in healthcare can serve patients as soon as possible. And the bill reduced the initial and renewal fees for medical gas wholesalers and manufacturers from the $5,260 to a $260 fee. This was part of what was originally included in the opioid bill, and they really don't play a part in that. And finally, the Minnesota Health Higher Education Authority. This expands the authority and scope of the Minnesota Higher Education Facilities Authority by allowing the Minnesota Higher Education Facilities Authority to provide financing to healthcare organizations. Currently, the Facilities Authority works with our private colleges to secure bonding. This will allow the same opportunities for our healthcare organizations. And then with that, the bonding limit is increased to accommodate the increased usage. And then there's a couple things just related to the forecast adjustments carry forward and the changes and the eliminations of some mandated reports. And with that, Madam Chair, that's just a quick overview of what's in our bill.
Thank you, Senator Utke. Very good. I believe we will go to Mr. Albrecht. Would you like to come up? Yeah. Okay, but isn't there?
That was amazing.
Thank you, Mr. Albrecht. Could you just individually give us a fiscal impact for this bill, even though the spreadsheet before you is for a combined?
You know, Madam Chair, I might be missing a document with that total. I believe it's about $1.5 million, if I remember correctly.
Okay.
Just
Mr.
for the portions in Senator Utke's bill,
Right,
yes.
okay. Well, we can come back to that, too.
And I can identify those things separately when I walk through the larger spreadsheet,
Okay.
if you'd like.
And I believe, do I see the commissioner here? Oh, is she on Zoom? Okay. Perhaps we will do the commissioner for Senator Abeler's bill, the next bill. We can just do it all at once, if that's okay. Thank you, Mr. Albrecht. With that, any questions at this point? I don't see any. We do have some amendments before us. Senator Benson.
Thank you, Madam Chair. Let's start with the A29. Senator Utke, this is a technical amendment, and I do not have a copy of that, but it should be available.
Thank you, Senator Benson. I think this is under Senator Utke. It is posted. And Senator Clausen, you may want to come up for this one. It removes immunity from criminal or civil penalties from the intractable pain bill, fixes the SRB appropriation from a drafting error, and adds effective dates and perhaps, Mr. Bodden, anything else that I missed? No? Okay.
Madam Chair, Senator Utke, any comments before I move the bill? Or move the amendment? I'm sorry.
Senator
Madam
Utley.
Chair, Madam Chair, this is a friendly amendment that we do accept. And you just did cover the high level, what the changes were in the amendment. And Senator Clausen did join us here at the table because of the part about the intractable pain bill. There were some changes there because parts were removed that affected the criminal and civil penalties. Went to civil law, and they did not, it was not something that they thought was a good part of the bill, so we removed it with this amendment.
Mm-hmm. Thank you, Senator Utley. Senator Clausen.
Well, thank you, Madam Chair, for allowing me to speak today. The amendment is part of Senate File 3566, Intractable Pain Bill. And just a little bit of history. As many of you know, in 2016, the Minnesota legislature passed a comprehensive opioid bill. And this was in response to an opioid epidemic that we were experiencing not only here in Minnesota, but across the nation. And at that time, over half the deaths related to opioid overdoses were contributed to prescription drugs. And so one of the main efforts in that bill was to look at opioid prescription limitations. And it has been successful. Opioid prescriptions have dropped anywhere from 40–60%, as have opioid-related deaths due to prescription drugs. One of the side effects of this, however, was that in building that the bill and looking at the CDC recommendations, they made the recommendation that no more than 90 morphine milligram equivalents a day could be administered through prescription drugs. And we have people here in Minnesota and across the country that are experiencing intractable pain. These are rather rare diseases in many cases, or other situations where the pain never leaves. And these were people that had prescription drugs above that 90 MME limitation. And as the effects of this were operationalized, doctors started tapering patients off of that 90 threshold. And this resulted in a big change for many people in their quality of life. It also sent out a warning to physicians that if you violate this, there are going to be consequences. So many physicians around the state actually dropped patients that were getting 90 over on the 90 MME equivalents, or they started tapering people down. And again, this started to affect people's quality of life. People could no longer work. You might recall, those of you that were in the hearing in Senator Utke's committee, there was a woman that testified that at one time she'd been an active person, she'd been working, she came in with a walker and just has experienced a tremendous downturn in her quality of life. One of the things that's in the bill and addressing the amendment directly is that in the bill, I'm going to read from an area so you have a little bit better understanding. In reference to the specific, again, amendment, no physician, advanced practice registered nurse, or physician assistant acting in good faith and based on the needs of the patient shall be subject to, and here's what the amendment is eliminating, any civil or criminal action or investigation. That's in there to protect our physicians who are treating people as people, not as a artificial threshold of prescription medication. It goes on to say that I'm going to start over because they have to get the whole language to really understand it, because there's a key word in two lines down. No physician, advanced practice, registered nurse, or physician assistant acting in good faith and based on the needs of the patient shall be subject to any criminal or civil action or investigation, disenrollment, or termination by the Commissioner of Health or Human Services, and here's the key word, solely for prescribing a dosage that equates to an upward deviation from the morphine milligram equivalent dosage recommended as the threshold by the CDC. The MMA, Minnesota Medical Association, opposes this amendment. You might have received an email from them about that. Across the nation, we have the CDC is looking at these guidelines. The AMA, American Medical Association, AMA, is looking at making some changes and recommendations as well. Now, the word solely is in there. You cannot be criminalized any civil or criminal action or investigation solely for prescribing the drug. But you can be held responsible if you turn back and you look at sub-articles 4 and 5, which is the notice of risk and the patient-provider agreement. And there are specific agreements that a patient and a physician must hold to in order for that to be an active agreement and the person receiving the prescription drugs that allows them a quality of life. So when I look at the amendment, when I look at the word solely, I don't believe that it really is applicable, and I think we need to protect some doctors that are out there right now extremely nervous. Some have dropped patients. Some are tapering people that really shouldn't be tapered. And I think that this is an amendment that should not move forward, Madam Chair.
Thank you, Senator Clausen. Any questions for Senator Clausen? Yes, Senator Johnson.
Thank you, Madam Chair. And Senator Clausen, I appreciate the concerns you bring up, but I do think there needs to be another look at this language in particular, where we're talking about we're relieving any civil diagnosed for administering this medication. We're really opening up quite a bag here. I know that there might be some folks who are dropping individuals who they don't want to be liable for anything that happens to them. But by opening this up, this really opens up the ability for somebody who may be acting in bad faith, that this is the only thing that they are doing in the state is administering this sort of prescription drug. And now we can't even investigate them or have any sort of action in looking at them, what the intent was or what the outcome was. I am very concerned that, especially without intractable pain being defined in this statute, that you could open the pathway to things like assisted suicide, which I know that's been a subject that's debated in the state floor too, where all of a sudden we can't hold anybody responsible for that sort of action as well. So to me, you're opening up a large door that might be bigger than what we anticipate at this point. And I understand that you say there are some restrictions on this, but I don't see those guardrails in the same light that you do. And I think this really opens up a door for individuals to administer some lethal dosage and not keep Minnesota safe. So I'm really concerned about this particular language in here, and I thank Senator Benson for opening that up.
Thank you, Senator Johnson. Senator Clausen.
Madam Chair and Senator Johnson, intractable pain is in the opening of the bill is defined with some examples. But I go back to, there are some guardrails here. The guardrails are in sub-articles 4 and 5 about the notice of risks and also the patient-provider agreement. And I think that, again, the word solely, simply for prescribing a medication that may be needed to provide a quality of life for a person, and allowing physicians to be able to do that without a civil or criminal penalty or action, I think is something that needs to be in the bill.
Senator Franson, Lopez Franson.
Thank you, Madam Chair. And Senator Clausen, thanks for bringing this to light. I don't currently serve on HHS, but these are subject matters that we've worked on for many, many years, and this is one of the issues that keeps coming up in one way, shape, or form, and I'm concerned about gutting this bill and taking this language away from the bill, where my understanding is that the stakeholders have worked on this for years, that it's been vetted, that it's patient-oriented, and I think we can probably find someone close to us in our families or our neighbors that have dealt with patients in this potential ailment of intractable pain, and when you do, this is a serious subject that I really don't feel comfortable meddling in it with just the assumption that this opens a Pandora's box. Like I said, it's been worked on by Minnesota Medical Association. These are the prescribing doctors. They're held to ethical standards. They're licensed. And Senator Johnson, you're an attorney as well, as am I, and we know that if you commit a wrongdoing, you can be held liable. This is not a situation where you can't investigate. It's a situation where you're not automatically triggering some charges solely because you're trying to do the best for your patient. And for us to meddle in this language at this point, I think it's actually quite harmful and potentially deadly for some patients in Minnesota. And so I do not agree with meddling with this language. You can still have a claim of negligence if there are wrongdoings. There is a court system that's there that we should trust, and that we should trust doctors that are doing this under the highest ethical standards of their practice, and that we should not be criminalizing them for doing what they, in their best judgment and training, is best for their patients. So I do support Senator Clausen in this concern that he has.
Thank you, Senator Lopez-Franz. Senator Marty.
Yeah, Madam Chair, I share what Senator Franz and Senator Clausen have said, and I will, just to make it formal, I'll move to strike lines 227 and 228 from the amendment, the A19 Amendment. And on that, striking that, Senator Johnson, when you were speaking to this, I think you actually explicitly said, if a doctor's not acting in good faith on this, and this very explicitly says they have to be acting in good faith if they are acting in good faith, and if it is solely based on the dosage they're providing in the best interest of the patient, that doesn't stop anything else. A doctor acting in bad faith, a doctor doing anything else, is absolutely not off the table. This is not a get out of jail free kind of card. This is simply saying, if you are prescribing a higher dose because of this situation, you're not going to be liable for investigation or action based on that alone. Act in bad faith, you're not protected. Act in some other way, you're not protected. Only in that one specific thing. And I think that, again, as Senator Clausen mentioned, this has been worked out for a long time on people who are trying to practice medicine in the right way, doing the right job, and they're being punished simply because our law allows it, because we appropriately wanted to make sure people aren't doing the wrong thing. But this is narrow language, only in good faith based on the needs of the patients, and it has to be solely based on that. If there are any other factors involved, you can go after them, and you should.
Thank you, Senator Marty. Senator Kiffmeyer.
Thank you, Madam Chair. I support the amendment. Probably one of the biggest things that I see here is that this agreement includes a description of expectations, responsibilities, and rights, but what's missing here is the protections in regards to someone who unscrupulously might take advantage of someone who is in pain at the time, and that's a vulnerability. I think that that's a concern that I would have, is that in this kind of a situation, a patient could be put in a situation. The other thing is there's so much a simpler way to do this. The testimony Senator Clausen had to do with this 90 limit. Well, it seems to me, instead of creating all of this that has all kinds of potentials and maybe even unintended consequences, right? But there's a simpler way to go about that, and that is to allow the physicians to go above that 90 with some justification. I mean, why are we taking a whole great big approach to this? Let doctors be doctors was said, yes. Well, then let's let them do that. and do that through what we have in current law in a much simpler way. This makes it a lot more complicated, and I think has great potential for unintended consequences that I'm not comfortable allowing this to go into law.
Thank you, Senator Kiffmeyer. Senator Marty makes a motion, an oral motion to delete line 27 and 28 on page 2 of the A29 amendment. Senator Benson to this motion.
Madam Chair, it's my understanding that these provisions didn't go through civil law, and we are trying to insert a penalty, change provisions, and so I would be much more comfortable if we respected the chair of civil law and didn't include these exemptions. If this language had traveled through civil law and the chair signed off and the committee voted on it, I think it would be in a different position. So I'm going to object to Senator Marty's amendment.
Thank you, Senator Benson. Senator Kent? Senator Kent, to this amendment, to oral amendment, or something different? Can you wait? Okay. Senator Lopez-Franzen.
Thank you, Madam Chair. And I'm actually quite uncomfortable having this conversation in the Finance Committee. We're not the committee of jurisdiction to make a very, very important change in this bill to either take or remove or strike. This is finance. This is dealing with dollars and not with policy. So I am extremely uncomfortable tackling this issue without the experts in the room.
Madam Chair?
Senator Benson.
This language did not go through civil law. It did go through Health and Human Services, but the language specifically relating to good faith, civil and criminal action investigation, disenrollment, all of that was the jurisdiction of civil law. Civil law did not hear that.
Thank you, Senator Benson. Senator Marty.
Madam Chair, but on that point, Senator Benson, the fact that civil law or whatever did not flag this, say they want to see it, we're taking the bill as it came from Senator Utke's committee in language that has been worked out by the parties involved, and if civil law wanted to see it, then it seems to me they could have requested it. But for us to take it out here because some other committee might want to see it, I just think that's inappropriate. This is, as Senator Lopez-Franzen mentioned, this is clearly not a finance issue. And it came here in this way, and making a significant change in the policy here, I think is questionable, and I urge your support for the amendment.
Senator Kent.
Thank you, Madam Chair. And my questions, and this would be for Senator Clausen and Senator Benson and potentially Senator Utke as well. What I think I'm hearing, and I've never served on Health and Human Services, but that this is, what is in the bill is the language that has been worked out by stakeholders. And what is in the amendment has not. Is that what I understood you to say, Senator Clausen?
Senator Utke. Senator Utke.
To Senator Kent's question, I think she was asking Senator Clausen. I had something I'll weigh in on that after fact, but I think you were asking Senator Clausen that question.
Madam Chair.
Yes, and we're going to have to wrap this up because Senator Clausen, this is just one minor piece. So, Senator Clausen.
Thank you, Madam
I'm
Chair.
indulging.
Senator Kent, this is a bill that's been a 2-year effort. It has been discussed with hundreds of people, quite honestly. And we do have Minnesota Medical Association. They are against this amendment. They want to see the state in the bill. And I think that as we've talked here, the word solely, and we've talked about this, I don't see that this really provides for doctors right now that are prescribing over that limitation. It provides a little bit of comfort for them. So they won't be releasing patients. They won't be providing a tapering situation that really changes the quality of life for Minnesotans that are suffering with intractable pain.
Madam Chair?
Senator Benson.
If I could, I checked on the status of the bill. Senator Clausen, your bill did pass out of Health and Human Services, referred to civil law and data practices, and so it is sitting there right now. And so this language was never vetted through the Senate Civil Law Committee. So while the doctors might agree with it, the lawyers might not. And so I would ask again that we reject the Senator Marty motion out of respect for committee jurisdiction, we take the A29 as requested, or we risk taking Senator Abeler's omnibus bill and having it re-referred to civil law.
Thank you, Senator Kent, and then I'm going to.
Thank you, Madam Chair. And that's what I was hoping to get the clarification that I was hearing this correctly. What I'm hearing, and Senator Benson's point notwithstanding, but going back to what Senator Lopez-Franzen said, the language that is in this bill from Senator Utke's committee has been worked over on by stakeholders. The amendment has not. So, I feel less comfortable adopting the amendment and taking it even further. But back to Senator Lopez-Franzen's point, these are tricky policy things that I don't think the Senate Finance Committee ought to be weighing in on. And that's my 2 cents. Thank you.
Thank you, Senator Kent. Did you have something? Okay. I am, well, as the chief author of the opioid bill several years ago, I completely understand on a major bill like that, there always are adjustments. What was a little frustrating for me back when we passed the opioid bill in 2018 or 2019 is, and the MMA has been a very, very supportive, wonderful to work with, but a lot of the problems that we had in the opioid bill were because of overprescribing. And now there's an adjustment. And I do believe that there is adequate language in the old bill to make sure that the doctor's prescribing is appropriate. It says, in the professional clinical judgment of a practitioner, more than the limited specific in paragraph below, is required to treat a patient's acute pain, the practitioner may issue a prescription for the quantity needed to treat the patient's acute pain. That and more farther down in there gives me the pause that MMA is not doing their job in securing the doctors to treat MMA. There needs to be some follow-up coming from MMA, Senator Clausen. There needs to be some training, and I've gone around with them on several occasions on this. What are they doing to educate and make sure that the doctors are prepared to treat the chronic and the acute pain? I do believe that this does need to go to civil law, and that it's still alive. I mean, it's obviously that it is moving in the House, and we can still work on it. But in order to keep Senator Abeler's bill alive and Senator Utke's bill alive, I believe that the oral amendment, Senator Marty's oral amendment, should be voted down, and we should vote to accept the A29 amendment. On that motion, Senator Marty renews his motion on deleting line 2728 of page 2 of the A29 amendment. All those in favor, please say aye.
Aye.
All those opposed, nay.
No.
Motion does not prevail. To the A29 amendment. And again, Senator Clausen, I appreciate the work you've done on this. I know you've worked on it for several years. As any good bill, it takes several years to get a good product, but sometimes that pendulum swings too far. And we do need to have the eyes, some very good eyes on this to make sure that we get it right, and there's some accountability in this bill or in your section, because we can't keep passing off the blame to somebody else. That's how we got into this opioid issue. So we need to help the doctors. They do have the guidelines. If there's fear, then MMA should be stepping up and making sure that there's training and there's education. Final comment, Senator Clausen.
Well, Madam Chair, I appreciate the time that you've allowed me to present this today. I think, there's always unintended consequences. I think, quite honestly, that we are dealing with this. We've got doctors that are getting letters from the department. They're being called forward to justify their actions. And so what we intended to do with this bill was to try to alleviate that and really make sure that doctors were treating people and their needs rather than enforcing an artificial MME limitation. So, thank you, I appreciate your time.
Thank you, Senator Clausen. Senator Benson renews her motion on the A29 amendment. Members? All those in favor, please say aye.
Aye.
All those opposed, nay. Motion prevails. The A29 is adopted. Senator Benson.
Thank you, Madam Chair. The A22 amendment.
Senator Benson moves the A22 amendment. It is posted, and we will be getting it shortly. Senator Lane, welcome to the committee.
Good afternoon, Madam Chair and members.
Senator Lane, to the A22 amendment, please.
Well, thank you, Madam Chair, and thank you to Senator Utke for helping along the way in response to the OLA audit that we just received about a month ago, actually, in reference to the state's Emergency Medical Services Regulatory Board. As many of you members probably remember, the OLA audit was less than favorable. That the EMSRB does need some changes as we progress forward. And I'd like to thank the EMSRB and the leadership of the EMSRB for their participation and cooperation, really, as we progress towards a new face on the EMSRB, really. I also want to throw a little bit of thank you to Senator Utke, to Representative Hewitt in the House for the work that he's done on this as well. And the members of the community, the emergency medical services throughout the state, the folks that have thrown some thought towards this bill and possibly additional adjustments to the board as we progress forward. So in reference to the A22, Madam Chair, this is really a two-part change to the board itself, being one, and then the term limit that goes in the last part of the amendment. It is a reduction in size in the board from 15 members to 8 members, which each you can see is starting on line 1.7 and progresses to page 2 to line 2.3 and then the change again at the end of the bill or the end of the amendment that talks about the member of the board may not serve more than 2 terms. So it's a fairly straightforward amendment, Madam Chair. I don't know if any of the members have questions for myself.
Thank you, Senator Lane. Any questions on the membership?
Madam Chair.
Senator Benson.
Because this does change the membership of a board, I would like Senator Kiffmeyer, Chair of State Gov, to speak to how she wants to handle this language.
Senator Kiffmeyer.
Thank you, Madam Chair. So yes, this is in the purview of State Gov, and we are hearing this language as an amendment to another bill tomorrow. And so with that plan in place, I'm okay with this going on the bill at this time.
Thank you very much. Senator, why did you take 2 members from outside the Summit County Metro on line 2.13? Just wondering.
Madam Chair, so the way that the bill read, or the way that the statute read in the past, was referencing the 14 members of the board. As that board decreased in size, so did the representation from the metro. So that's just to correlate with the total number.
Very good. Okay. With that, Senator Benson renews her motion on the A22 amendment. All those in favor, please say aye.
Aye.
All those opposed, nay. Motion prevails. The A22 is adopted. Thank you,
Madam Chair.
Senator Benson.
Madam Chair, let's move to the A27 duplicate background studies.
Senator Benson moves the A27 amendment.
Madam Chair, the duplicate background studies language is incorporated into this bill. This does a couple of significant things as we're trying to get between the licensing boards, MDH and DHS. We were going to have all of the licensing information checked quarterly. We're changing that to daily. We're changing information requirements to include the individual's name, alias, date of birth, license number, date license was issued, et cetera, last 4 digits, so that they can do a more effective process of doing the wraparound background checks at the Department of Human Services. And I think that is the most significant part of this bill. Largely, it is technical.
Thank you, Senator Benson. Senator Uckey to the amendment? Good.
Thank you, Madam Chair. Yes, I support it.
Thank you. Any questions on the A27 amendment? All those in favor of the A27 amendment, please say aye.
Aye.
All those opposed, nay. Motion prevails. The amendment is adopted.
And
And Senator Benson.
Madam Chair, the A17 amendment request from Senator Abeler to make sure that as we move to pharmacy techs administering vaccines, that they are fully informing the patient about contraindications and precautions related to vaccination. And we had raised this in the HHS committee. There was an amendment to take out some language that was important to Senator Abeler. We're putting that back in and adding comfort language.
Senator Benson, do you make a motion?
I move the A17.
Senator Benson moves the A17 amendment. We'll wait till everybody has it. Senator Abeler, you good with this?
Well, just briefly, I appreciate that, and I don't think anybody meant anything harmful about cleaning up how pharmacists can administer, but there's some important safeguards that I think we want to retain, and I appreciate the pharmacists working with me.
Okay. Thank you. Okay. All those, Senator Benson renews her motion on the
Madam Chair, sorry.
Senator Kirkmeyer.
I had all my papers here. I couldn't quite
Yeah,
get
yeah.
to finding my button in time for you. Got to go back to the old-fashioned way. I'm interested in understanding. I appreciate pharmacists as well. There's nothing to do with that. But I see a great expansion of their scope here as far as dispensing medications to now going quite beyond that. And so I am concerned about this and where the future of this is, as far as the scope of pharmacists. So if you could explain to me a little bit more about how the practice of pharmacy, ordering lab tests, collecting specimens, interpreting results, notifying the patient of results, referring patients to other healthcare providers, performing tests authorized. This is a tremendous change from in the pharmacy scope of practice. So if I could have a greater understanding of why doctors are insufficient to do this, APRNs, PAs, all kinds of people that we have in the medical system that has a primary care physician, whole patient look. And so I just have concerns about this area here.
Senator Abeler.
Well, thanks, and briefly, and we have a testifier if you want to just, no, you don't. Anyway, so this is, was vetted in the committee. It was determined that it was an appropriate role for the pharmacists given their training, and the particular emphasis was on dispensing vaccinations, as I believe. I was the author of the bill that gave them the chance to do that earlier, 10 years ago or something. But I don't know, it was Senator Duckworth's bill. I'm just speaking on behalf of what I know about it.
Senator Kirkmeyer.
Thank you, Madam Chair. I served on HHS for 10 years, and I expressed my concern at the time we did the vaccinations as well in the pharmacy, and the concerns I had to do with privacy, had to do with the whole patient kind of a concept. I'm a big supporter of primary care physicians. That has been the backbone. Even we in our state employee insurance plan are required to have a primary care home, a home where we are able to have kind of that whole patient, and that's a really important consideration. And now we're taking a piece of this away and taking it totally out. And so I just would like to hear more. And not only that, the question I have sometimes is, what next? I expressed my concern back when it was dealing with vaccines, especially reactions and allergies and other things like that. And so I'm expressing my concern here again. at saying, so what is next? What's the overall plan? But this one is a huge, big step, and it doesn't have anything to do with me whether it's this senator or that senator. I look upon this issue here, and my concern is based upon the language that I'm seeing in this bill. So if someone could address that issue for me, that would be helpful.
Senator Abeler, or Senator Utley. Senator Utley.
Go ahead.
Madam Chair, all I was going to say is we do have Mr. Humphrey here who brought that if you wanted any additional testimony. If not, we'll.
Yeah, no, thank you, Senator Utley. We just stick to either commissioners or senators. Senator
Madam
Benson.
Chair, I'm going to give this a try. So as we look at page 12, line 22, all of this is pursuant to protocol or collaborative practice agreements, and so it would only be to the extent of their training and their relationship with a medical professional who had the authority to establish protocol and collaborative practice. And so, yes, I agree, it is a significant expansion, but there are some guardrails on it, and we have, throughout COVID, had pharmacists doing much more. I share your concern about impinging on primary care, but we have had them running testing and doing vaccinations as part of the COVID vaccine rollout and the COVID testing rollout, and I think that's where some of this came from.
Thank you, Senator Benson, and I will attest, Senator Utley and Senator Johnson, myself, we struggle for primary care providers in the districts we serve, and our pharmacist is sometimes our first go-to to ask what's happening. So,
Well, Madam Chair, that's the whole reason why we did nurse practitioners, advanced practice practitioners, PAs, and so on. And then we ought to just strike the whole having primary care clinics being a focus and importance of the central care that we have, because obviously it doesn't really matter. You can just go to somebody, and pharmacists aren't just somebody, but that you can go in that situation outside the context of the whole body's care and other issues that are relevant, that a family practice physician or a clinic has access to all the records and all the issues that they're looking for. I can't let something like this go by and just not speak up for it. As a registered nurse myself, formerly dealing with these things and being on this committee, I just think it's something that I find that I'm very uncomfortable with.
thank you, Senator Kiffmeyer. Well, Senator Benson renews her motion on the A17 amendment. All those in favor say aye.
Aye.
All those opposed, nay.
No.
The motion prevails. The A17 is adopted.
Madam Chair, that was my last.
Senator Benson? Yep.
That was my last amendment.
Okay. Senator Utley, we have final comments unless there are questions. Senator Marty.
Madam Chair, I have A19 amendment I'd like to offer.
Senator Marty moves the A19 amendment. It is posted and sent out, yes.
And Madam Chair, this is something from the governor's budget that our colleague Senator Port, who's here, has pointed out the urgency of. There are estimated 100 million people worldwide who have long COVID. They say as many as 10 or 20% of people who get COVID end up with long COVID, and we don't know enough about the lifelong impacts this could have on people. We don't know the details of it. And when I saw this provision and I see the needs for it out there, I wanted to make the analogy to something where the Senate came together in a very positive, bipartisan way a few weeks or month ago when we dealt with ALS funding. I'd say something that brought very close to home in the Senate because we've had Senator Tomassoni who's dealing with the struggle on that right now. And I think this is a similar type of thing, and that while long COVID we hope is nothing as serious as ALS, it also affects far, far more people. And it's something that at this point, the lack of support for people is not there. And I think that this is very helpful to monitor it, to help provide support to these folks, to have grants to community groups that will provide evidence-based actions to people who are struggling with long-term COVID. And that's why I would love to have this be treated in a bipartisan way where we recognize the seriousness of this issue and we provide some funding for this. And so I'd like to move the A19 Amendment, and I would love to ask if the chair would indulge me to ask for Senator Port, who's in the room, if she could speak to this, because she's been going through this issue right now, and I think that would be an appropriate thing to do if you were willing.
Thank you, Senator Marty. Senator Port.
Thank you, Chair Rosen. I've been dealing with long COVID now for about 18 months, and I am one of many. It is a unique experience to, every time you go to the doctor, have the doctor be talking about, wow, I can't wait to tell my colleagues this new symptom, this new thing that we learned today, this new test result, because literally every time that we go to the doctor, those of us dealing with this, we're learning something new and our doctors are learning something new. It is a disease we don't know much about. We don't know the long-term ramifications of it. And it's estimated that hundreds of thousands of Minnesotans will be affected by it, and that the economic impact on Minnesota will be in the billions of dollars. So this is personal for me, yes, but it is also spread throughout our communities, throughout the state of Minnesota, and we have a moment right now to make an investment, $10 million over 3 years, to make sure that we're doing the research necessary, to make sure that we are getting out to the communities who are most hard hit from COVID, which we know we need to spend extra time and energy to specifically reach those communities, to make sure that we are doing the research necessary, that we are spreading the scientifically found treatments as it's coming up. Not everybody has the privilege to be able to go to the doctor consistently, to be able to keep going, to keep trying new things. So we need to make sure that we are spreading the scientific evidence of what is working. This is an investment that, again, is personal to me, but is really something we should be looking at as a long-term economic investment in Minnesotans. This could affect our workforce for years and years to come.
Thank you, Senator Port. Senator Port, was this a bill that you had introduced?
No, it was in the it was part of the governor's HHS bill.
Okay, thank you. Senator Benson.
Madam Chair, Senator Marty, walk me through the appropriation, because things seem unbalanced. Line 2.15, 2.1 million is for administration and 550,000 is for the grants. Normally,
Thank you for bringing that up, Senator Benson.
we flipped that.
Right, that's a lot for administration, and $500,000. Senator Marty.
Thank you, Madam Chair. Senator Benson, yeah, good question, but this is for the department to develop statewide guidance for treatment and care coordination, provide resources to support survivors, and the grants are for organizations that serve communities who have been hard hit by COVID with it. Most of this funding most of that funding in that year is supposed to be helping the department to do the work raising awareness and providing guidance on how we treat it. So in other words, this is meant to not just give grants to people who are working with it, but also to figure out how we should deal with this, how we are going to deal with doctors don't know. I mean, when I read your story, Senator Port, I mean, one day you feel fine, next day it's some new symptom. And I think when you describe how you deal with your doctor, I think that's what we're hearing from a lot of other doctors and others as well, that they don't know how to deal with it. And so this is, in a sense, having a statewide effort to try and help coordinate what information is getting out to people on this. That was, again, this was a part of the governor's budget because I think it is a reasonable thing to deal with in urgency now, because if we have, I don't know how many Minnesotans have now had COVID, but if even 10% of them have long COVID, I think this is going to be a huge hit that we haven't even started to figure out. And maybe it'll all go away after 3 years long COVID ends, but I don't think we can count on that. And I think that having the protocols statewide for how supporting doctors and treatment providers and so on, and how to understand it, so there's a common source of information for them. I think that's why much of this money is going for what's listed as administration, but it's to develop these guidances and things for the families.
Madam Chair?
Senator Benson.
And Senator Marty?
There's only about 3 million left.
I agree we're going to have to find out this information, but I'm thinking places like Johns Hopkins would be doing white papers on this, Cleveland Clinic, that there would be peer-reviewed medical information coming forward, and then it would be appropriate for the Department of Health to disperse it. I'm thinking it's not the Department of Health's job to do this kind of research. I would think the University of Minnesota School of Public Health would be better suited.
And my thoughts, Senator Benson, is the governor probably should have appropriated, this would have been a very good
It's appropriate
appropriation from.
use of COVID funds.
Right,
Yeah,
COVID funds, right.
absolutely.
Right, Senator Champion.
Thank you, Madam Chair, for the opportunity to speak briefly about this. As I was listening, and I was listening intensely about this discussion, it reminds me of my good friend, who I will just call Lonnie. I won't give his last name. Lonnie is one of the estimated 100 million people worldwide suffering from long COVID, which is a debilitating condition where COVID symptoms, from my understanding, linger for a long time. Lonnie, in fact, has had this going on for the last 2 years, believe it or not. And each time that I'm with him, or even talking to him, he's telling me about the pain that he's feeling throughout his body. He's telling me about his inability to breathe sometime and the extreme fatigue that he feels. And I did see it written that this is not only a health issue, especially Senator Pratt and I sit on the Jobs Committee, and we are always interested in how do we make sure that Minnesota continues to be globally competitive. But I believe, just from some of the things that I read, that long COVID will have a huge impact on businesses and on our economies. And so, some people, think it's going to account for over 15% of unfilled jobs. I don't know all the particulars, but what I do know is that we have to do something, and that I think it would make sense for us to make this investment and do the things that we need to try to understand what's going on. And I don't think sitting on the sideline is an option. I think we have to get in the arena, and we have to do the things that's necessary. I must say also that I was struck by the information I read about Senator Port, even as she sits here, and even some of the reports, because she instantly reminded me of my friend Lonnie. And Lonnie is a wonderful person, and that is not to suggest that Senator Port is not. I want you to know that I think you're wonderful too. But what is being highlighted is something that some of us may not be experiencing personally, but we can do what the moment requires, which is the investment from this committee. So I asked my friends around the table for us to find the necessary resources in order to make this necessary investment. We are learning a whole lot about COVID and all the variants that are happening. But again, I would just hope that we will meet the moment, because not only does one's personal health depend on it, but our great state and the soul of our state depends on it when we think in terms of continue to be globally and nationally competitive. Thank you.
Thank you, Senator Champion. Senator Port and I did have a conversation yesterday, and my words to her was to call Senator Abeler, and if he can find it from his budget, then that would be appropriate. But to expand what his budget is, I'm not sure if you two have conversed. Okay. I do feel that that is a tremendous amount of money for the administration piece of it, and I think that if the Department of Health is willing to go ahead with what they would like to do in their research, I do believe with Senator Benson, they are probably going to have to, we're going to have to rely on other sources of adequate research. The grants is another story, but that is just a lot of money to the Department of Health for something that I don't think they're equipped to handle at this point. Senator Ecke, do you have thoughts?
Madam Chair, you are saying just what I was wanting to say too as I read that. The way this is written with the large numbers to administration, no matter how we think about it, when you read it, to me it's backwards. We'd be just giving them a lot of money, where if we were to spend any money, you'd want it for the research side of things to actually do some good. So, but you covered that very well, so thank you.
Thank you. Senator Marty.
Madam Chair, it was pointed out, first of all, it's not meant as research so much as epidemiological studies and surveillance in the community and so on. And I think the wording to call that administrative in the language is unfortunate choice of language there. But it's not for, quote, administering grants. It's for tracking what's going on in the community and alerting people in the community to where they're having larger outbreaks of long-term COVID. So I understand that the word, I would argue the word should not be listed as administrative there, but having said that, the purpose of the grant, the purpose of the money is for not for administering grants. The purpose of the money is for surveillance in the community of how extensive it is and for working with doctors and providers to make sure that they have the latest information out there, not to do the research, but to make sure that communities know what's happening in them and that people are tracking it. So I'm not going to defend the use of the word administration there, but that's not really what it's for.
Okay, thank you, Senator Marty. And perhaps the governor become engaged in this and in the future, but I think we'll take a vote on your A19. And perhaps this needs a little more work, Senator Ford. With that, Senator Marty renews his motion on the A19. All those in favor, please say aye.
Aye.
All those opposed, nay?
No.
Motion does not prevail. Senator Marty.
Madam Chair, I wanted to ask you, because this morning we had a discussion of, I think you may not have been in the room at the time, but when we were discussing mental health services in the education bill, or the lack of mental health funding in there, I think Senator Benson mentioned Senator Draheim and your mental health package, and that it is moving separately, we're told. Again, we're in the dark of what's moving where and so on. It kind of, we see it on the agenda or we don't see it on the agenda. And it's, this bill is, Senator Draheim's bill is not on the agenda here today, and I'm wondering what the plan is. There's no mental health spending in the HHS bill here. This was a significant bill that I think you were involved in as well. And I guess I'm curious, what's the plan for it? Is that being moved? Is that part of your magic targets or whatever? Could you fill us in on what's going on?
Thank you, Senator Marty. Yes, there are no magic targets, but there is a strong commitment for $50 million for mental health. The Senator Draheim now is the chief author, and it has been worked collaboratively across the aisle. It has gone through rules, and because of the timing, it was hard to get some of the components put together, so it went through rules last week, I believe, and it is on the floor. Great. Yeah. it's on the floor. So it's been through the appropriate committees, through rules, and now onto the floor. So we're going to have a separate vote on the floor for mental health.
And Madam Chair, how is that going? Where is it is the House dealing with its mental health in the HHS budget, or is it dealing with it as a separate bill?
I don't know, Senator Marty.
Madam Chair, it's
Senator
a
Ucky,
it's a
can you please help me
standalone
out?
bill.
It's a standalone bill, thank you.
So Madam Chair, Senator Utke, so in other words, that the mental health legislation, I think it was about a $75 million package that is being pushed, that is moving in the House, and it's, even though we have no clue of where it is in the terms of your budget priorities or targets or whatever you're calling them, I guess I'm wondering, is there a reason not to put it in this bill? Because you've been carrying a lot of bills in two different places and so on, and Senator Abeler, I believe, is going to do one of his bills in two different places as well. Is there a reason not to put it in here? Because I think a lot of us who want to see some investment in mental health, this would be the day to do it. And
Senator Marty, I'd like to correct myself. Went through rules, it's being processed off the floor, it's coming to finance.
And Madam Chair, your intent is to pass it as a separate bill, and then it would match up presumably with the House?
Yes. We're giving special attention to mental health.
Madam Chair, I had prepared it as an amendment here today. I could offer it here as an amendment today, but if you're committed to making it pass out of here with the money in it, I won't offer that here today, but I just want to make sure we don't ignore that because, again, the education bill didn't have anything for mental health. There's very little happening for mental health this year, and it's a pretty serious crisis, as I think you understand as well.
Mm-hmm. Absolutely, but I believe when it comes to the finance, you'll see the commitment and the support, and I hope we'll have your support too, Senator Marty. Any further amendments? Senator Ucke's bill.
Madam Chair.
Senator Marty.
Just wonder, because Senator Champion was talking about the lead abatement in the schools, and we talked about that this morning, and we were told that would be more appropriate in Health and Human Services, and I'm wondering if he was planning to pursue that or not.
Senator Champion.
Thank you, Madam Chair. Thank you, Senator Marty, for that question. I have been working on that, and then I did learn some information that there was an investment of $2.8 million on the very issue of making sure that schools could test and that they would test at the level of my amendment. And perhaps Senator Benson, who wanted to make sure that she showed me that ahead, and then I looked at it, and I also talked to Senator Ucke as well. And so if either one of them want to fill in, because I've been working on this, because I wanted to make sure it could get done.
Absolutely. Anybody? Senator Ucke?
Thank you, Madam Chair. And yes, what was referenced is from last year's 2021's bill. We had $2.8 million for fiscal year 22-23 and $2.6 million for 24-25 appropriated for that exact purpose.
Okay, very good. Thank you, Senator Ucke. Thank you, Senator Champion. Okay, with that, we're good. Senator Benson, would you like to move Senate File, and excuse me, no, we're going to lay Senate File 4198 on the table. Sorry, Senator Benson. Okay, now Senator Abeler's policy HHS bill, Senate File 4165.
Thank you, Madam Chair, and that was about a 15-page bill. I guess mine, the one we're talking about now, is only 248 pages, and it might be quicker just to read it to members. And I don't know what you want to know about the policy in there. There's probably at least 20 bills, a number of department bills, talking about FAME, I don't know if you want the list of all the bills, but it's, a lot of it is pretty garden variety human services stuff. They're all important to whoever is affected by it. Some of the items in the bill have to do with, we've been focusing a lot on workforce and trying to find ways to make some of the workforce be more efficient or more effective. And that's has been what we've been talking about for a long time, talking about increasing capacities in group homes, talking about monitoring and overnight supervision, working with ARM and Moore and the home care folks. Really, that's been the real focus of our work that's been unique. In talking with my counterpart across the street, a good number of these items are going to be in, they're just good, solid policy. Some of the unique things that the Senate has that the other body does not have has to do with this efficiency, effectiveness matter about trying to help group homes, nursing homes, et cetera, to actually continue to serve. And so, Madam Chair, I'm willing to spend any amount of time you want going through it. The index for these is 5 pages long. So we've got probably more than a dozen authors of both parties. And we've worked with the department a great deal on technical assistance. The reason it's here at all in the first place, in an ordinary world it would not have come here. Some of the items that we had in our bill actually did involve some fiscal impact, which we've been evaluating, and we're in a position to address. It's our intention that the body of this bill would in fact have no fiscal impact. And so there's an amendment that will take care of that. So I don't know, I can talk as long as you want, but I'm just trying to help you focus on what's here and what's germane to the committee.
Thank you, Senator Abeler. We do have the A22 amendment that does strip the money out, as you were saying. Senator Benson, would you like to move the A42 amendment?
Madam Chair, I didn't have it in my packet. My apologies.
It's being handed out right at this point, so get the bill in order.
There's an A35, Madam Chair, the memo. There's an A27 that is the body of the policy.
That's in your Senate File 4410.
It's an amendment to 40. I don't know how you're handling this. So if you're working off the bill, I just have a different cheat sheet than you do, Madam Chair.
So got my handy dandy cheat sheet.
I would go with yours.
So we have Senate File 4165 before us, Senator Abeler, and
We're just doing the lead on that one. Oh,
right.
Okay. Okay. Let me just step back. Senate File 4165 is a policy omnibus with money. This bill is going to become simply a vehicle, and so I understand now. So the A42 is in a couple of places. It's just the most bland revisor instruction, and then working with our other folks will come up with a vehicle to take some of the policy out should we need that. So if someone would move the A42, that would
Senator Benson, would you like to move the A42, please?
Madam Chair, I'll move the A42.
On that motion, all those in favor, please say aye.
Aye.
All those opposed, nay. A42 does pass. Okay.
And that could go to the floor, Madam Chair.
Right. And then at that point, Senator Benson, would you like to make a motion to send 4165 as amended to be placed on general orders?
So moved, Madam Chair.
On that motion, does everybody understand what we're doing here? Clear as mud?
There's my.
Okay. On that motion, all those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. Senate File 4165.
I appreciate the two ayes, Madam Chair, on that motion.
Okay. Now we have Senate File 4410 before us, members, and that is Senator Abeler. Would you like to go through that? And then we will go through the finance part of that.
Thanks. I thought we were doing the other one at the end, so
That's fine.
Do you intend to have Mr. Albrecht walk through the spreadsheet?
Yes, if you just want to give us a brief on this.
Yeah, sure. So I'm just trying to make it short as we can, given what time of day it is already. So Senate File
Senator
44.
Abeler, grab that microphone again, please. Thank you.
So Senate File 4410 is the budget omnibus from the Human Services Committee. It's $1 billion in rates and efficiencies with a few other small items that are of almost no size. It refinances $2.4 million and buys some odds and ends that are useful, FAME and some others. But in terms of the in terms of the bill, it's $1 billion. It's gone to serve rates across the industry. There's well over $300 million going to nursing homes, $240 million going to group homes. It raises the rates for intermediate care facilities to a very reasonable level. in short, it will make a real difference in the long-term funding, the long-term sustainability of the long-term industry we rely so much on. It also rewards facilities for taking care of people on elderly waiver, which are both home services and services in assisted livings. Many cases, folks been out of poverty, and they're told they can stay, and now they can't because the people are kicking them out because they don't take elderly waiver. Now it's a much better system, and if you can keep them in their homes longer, it does that. The home care rates are increased. The low-end nursing assistants, or whatever they call them, are increased to the max possible. There are rate increases ranging between, I think, 7% and 30%, Madam Chair, across the various industries. So just as a capsulized summary, that's the shortest I can make it and have some content.
Thank you, Senator Abeler. Now we'll bring up Mr. Albrecht. Good afternoon, Mr. Albrecht.
Good afternoon, Madam Chair, members. I think the term or the numbers that Senator Abeler is using to talk about this bill and that everybody has been using to talk about this bill, the $1 billion, I think just needs a little bit of context, because usually we talk about a target or a spending priority with respect to the amount in the current biennium. In this case, most of the dollar amounts that Senator Abeler talked about are for 3 years. The $1 billion is for 3 years. I think partly due to the way I work with Senator Abeler, a lot of his proposals, he has numbers in his head that are for 3 years and not just for the current biennium. And that'll become apparent as we go through the more detailed spreadsheet.
Mr. Albrecht, hold on one second. Senator Kiffmeyer, do you have a question about something that we're working on right now? You're good? Okay, thank you. And Mr. Albrecht, are we working off of this spreadsheet here?
Madam Chair, yes.
Okay, wonderful.
But I did want to just, if anyone is paying close attention to the spreadsheet, they will notice at the top of it, it says the target is $854 million. So I thought it would be helpful to explain how we get to that number, which is the $1 billion of priorities that Senator Abeler described. And then my understanding from Mr. Naumann is that the high-level Senate budget relies on this adjustment between the general fund and the healthcare access fund for the amount of spending on medical assistance. And so that reduces the general fund by $147 million. And then Senator Utke's bill had priorities with $1.152 billion allocated to them. And that is where the $854 million comes from.
Madam Chair?
Senator Benson?
Mr. Albrecht, as you're going through, I know some of these are 3-year priorities and some are ongoing. Could you just comment as we go through what happens off spreadsheet? I know we don't have any asterisks in this, but it's just helpful to understand if the 2025 number is indicative of the 2026 number.
Thank you, Senator Benson.
Madam Chair and Senator Benson.
Mr. Albrecht.
As a general rule, I think it's fair to assume that there is not exponential growth beyond the spreadsheet in these proposals. That was a concern of Senator Abeler's, and to the extent that it did exist ever in these proposals, it has been addressed before being put into this bill. So, Madam Chair and members, just to orient you to the spreadsheet, as I indicated, the target is at the top there. Lines 5 through 14 show the appropriations for each biennium by fund. And of particular interest usually is the general fund, and those amounts are on line 6, $155 million in the 22-23 biennium, and almost $699 million in the 24-25 biennium. Lines 18 to 26 track the activity in the Healthcare Access Fund, and the Senate's position at the end of fiscal year 2025 is to have a balance in the Healthcare Access Fund of $2,000. Lines 28 to 32 track the activity in the federal Tanf Fund, and the Senate's position leaves at the end of fiscal year 2025 $117.3 million there. Lines 34 to 40 track the medical assistance proposals in the bill by the individual categories on lines 35 to 39. And if those amounts interest you, you can spend some time there looking at them. Very bottom of the page, line 42 until the next page, page 2, line 94, show the totals for each department in the jurisdiction, and then for each fund within each department underneath the totals. On page 2, on line 106, is where the proposals for the Department of Human Services begin. The first item is on line 108. This lines up with a component of the governor's long-term care workforce revitalization proposal, but it only aligns with the part of that proposal that is a rate increase for PCA providers. And the amounts for that are shown on lines 110 to 113. And the amounts that the Senate carries are double the amounts of the governor's proposal. The total for the first biennium is $32.2 million, and for the second, $152.9 million. On page 3 at the top on line 123 is one of the proposals that Senator Abeler mentioned. This is a rate increase for the disability waiver rate setting methodology for rates that are determined under that methodology. There are adjustments to a variety of the components of that rate methodology, and those are reflected on line 125. And then on line 126 is an additional amount that would be allocated to those individual components described there: the competitive workforce factor, the base wage index update, and the CPI update. On line 129 is a rate increase for nursing facilities. That is $56.9 million in the first biennium and $168.1 million in the second. The next proposal is on line 137. This is an enhanced rate for high-needs PCA recipients, and that is $856,000 in 22-23 and $3.9 million in 24-25.
Mr. Chair.
I'm sorry. Senator Marty.
Mr. Chair, Mr. Albrecht, for the enhanced rate for high needs PCA, is that how many hours a day they need the services, and how much of a bump are we giving them for that kind of money?
Mr. Albrecht.
Mr. Chair and Senator Marty, yes, it is tied to the number of hours, and I do not know the specific rate increase that is.
Senator Abraham.
Thank you, and Mr. Chair, Senator Marty, it's over 10 hours, and I think it's a 40% increase.
40%, Mr.
Yeah, those are people that can't get out of bed.
Right.
Yeah,
Thank you.
Hey, Mr. Albrecht.
Mr. Chair and members, the next proposal is on line 144. This is a rate increase for non-emergency medical transportation providers, and the total is $5.4 million in the first biennium and $12.6 in the second. On line 151 is a related proposal also for non-emergency medical transportation providers, and this is a fuel rate adjustment that is tied to the price of gasoline, and at least the way it's came through on the fiscal note is it would go down over time under the assumption that the price of gas is going to go down in the future. The total for that proposal is $1.6 million in the first biennium and $676,000 in the second. On the next page, on page 4, on line 159 is a rate increase for home care providers. That is $14.9 million in the first biennium and $75.1 in the second. On line 167 is a rate increase for homemaker services, which is $961,000 in the first biennium and $6.9 in 24 and 25. Line 174 is the elderly waiver rate floor proposal. It would, the appropriation for that would be $3.3 million in 22 and 23 and $13 million in 24, 25. Line 179 are changes to the elderly waiver rate framework. And the total for that is $5.8 million in 22, 23, and $110.8 million in 24 and 25. Line 188, Senator Abeler mentioned this proposal. It relates to the rates for intermediate care facilities, and it establishes a rate floor and would spend $5.8 million in 22 and 23 and $27.5 million in 24 and 25. At the top of the next page, on page 5, is on line 193, is a proposal to increase the base wage index for employment exploration services. That's $64,000 in the first biennium and $653,000 in the second. Line 198 relates to setting a market rate for respite services. Sorry, that is a typo. It's IHS, hourly billing. Anyway, it's a systems cost of one-time systems cost of $27,000. Line 202 is the PC, a proposal to allow parents and spouses to bill PCA hours, $736,000 in the first biennium and $7.2 million in the second. Line 208 is a proposal to have the commissioner develop a model of shared services for home and community-based services. It's mostly a one-time cost of $372,000 with a small tail of $4,000 per year. Line 216 is a proposal to develop a life-sharing service and then to implement it with $125,000 in the first biennium and $3 million in the second. Line 223 is a proposal that would allow PCAs to drive their PCA recipients for personal needs to make that an eligible activity. And it fills a gap between implementing the old PCA payment framework and the new one, which is why the funding phases out over time. But it's $1.6 million in 22, 23, and $82,000 in 24, 25. On the next page, page 6, on line 229 is a proposal that would add additional money to the previously enacted emergency staffing pool and extend the period of time for which it's available. And the net cost of that is $2.8 million one time in 22, 23. Line 234 is a new grant proposal for residential settings to help prevent closures of those facilities. It is an ongoing appropriation of about $6.7 million. Line 288 is a premium reduction for the medical assistance for employed persons with disabilities program. That's $2.8 million in the first biennium and $6.3 in the second. I think Senator Abeler made a reference to this proposal on line 305, which increases the MFIP earned income disregard to 60%. This is spending in the Tanf Fund of $4.9 million in the first biennium and $14.7 million in 24 and 25. The next proposal is on line 453. This is additional money for the existing Family Assets for Independence program of $225,000 per year ongoing. Line 457 is a proposal that is related to money but doesn't directly involve money. It would have unexpended amounts from what is called the SILS grant at the end of the biennium go to operating grants for the Minnesota Centers for Independent Living. Line 459 is a proposal that would repeal what are known as the DTH county grants with general fund reduction of $811,000 per year. That is the source of funding for many of the following items. Line 463 is a grant to the Minnesota Association for Volunteer Administration of $100,000 per year ongoing. Line 467 are changes to the previously enacted sub-minimum wage task force, one-time appropriation of $95,000. Line 472 is a proposal that allocates base funding for chemical dependency treatment to a grant to a recipient, a provider, I should say, in Anoka County for substance use disorder services. Line 474 is a new grant to the Quality Parenting Initiative of $100,000 per year ongoing. Line 478 is a new grant to community organizations for $100,000 ongoing. Line 482 is a grant to an organization called Wellness in the Woods of $100,000 per year ongoing. Line 486 is a grant to a Rochester nonprofit recovery community organization with $53,000 in the first year and then $55,000 per year ongoing. Line 490 at the bottom of that page is a grant to a recovery community organization in Olmsted County of $100,000 per year ongoing. On 494 at the top of page 8, this is one of the proposals that Senator Utke mentioned. It's related to the medical gas manufacturer's fee reduction, which has the effect of reducing the amount of funds available to the Department of Human Services for grants in the Opioid Epidemic Response Fund, and that's what this proposal is about. It's a reduction of $235,000 per year ongoing. Line 498 is a proposal for a rate increase for a housing support provider in Douglas County, which is $106,000 in the first year and $116,000 ongoing. Line 502 is a proposal that would move the grants currently at the Department of Human Services for fetal alcohol spectrum disorders to the Department of Health, beginning in the next biennium, and the amount that would move from DHS to MDH is $750,000 per year. Line 588 is a rate increase for adult day treatment services. This matches up to a governor's proposal. The amount in the first biennium is $261,000, and in the second, it's $1.3 million. Line 689 is a provision from Senator Utke's bill. It relates to MA coverage for vaccines administered by pharmacists. The language of the proposal is included, but the admin money on the fiscal note is not. On line, that's what the hash marks there indicate. On line 691 is a proposal relating to licensed collaborative practice for dental hygienists, making them eligible for MA reimbursement. Again, the language is included, but the administrative funds are not. Line 704 is also from Senator Utke's bill. This is a proposal to eliminate duplicative background studies, and it has spending of $435,000 in the first biennium and $692,000 in the second. Line 767 is the piece of the Senate's budget that I mentioned in the beginning that would increase the Healthcare Access Fund expenditures for MA by $147.1 million and reduce the proportion for the general fund by the same amount. Madam Chair, that is the end of the Department of Human Services. On page 9 at the top are 3 proposals for the Department of Health. The first one on line 789 is the other side of the fetal alcohol spectrum disorder grants, adding that money to the base for the Department of Health in the tails. Line 981 is the Audiology and Speech Language Pathology Interstate Compact, $164,000 in the first biennium, and then the revenue begins to exceed the expenditures in the second biennium by a similar amount, well, the same amount actually. Line 986, Senator Utke talked about this in his remarks about his bill, is the regulation change for closed loop heat exchangers. And that proposal is in the State Government Special Revenue Fund with $68,000 in the first biennium and $102,000 in the second. The next 2 proposals are at the Health Related Licensing Board. The Board of Nursing has the Nurse Licensure Compact with expenditures in the first biennium of $157,000 in the State Government Special Revenue Fund, and an impact in the second that is a combination of expenditures and lost revenue for $280,000 per year. And then on line 1050 is the medical gas fee reduction that Senator Utke mentioned and that I mentioned earlier in the DHS portion of $235,000 per year. And then the last item on line 1112 is related to the Audiology and Speech Language Pathology Compact that has an effect for the Professional Educator Licensing Standards Boards of $25,000 one time in fiscal year 2023. And Mr. Chair, that is the end. I'm sure you've waited your entire career to preside over that.
That's fine.
It looks the same as what I read last night before I went to bed. So, members, any questions? I have a couple, but go ahead if you have some questions. Senator Marty.
Mr. Chair, question just out of curiosity, since I don't know how this works, but the residential settings closure prevention grants,
Which
I
line?
understand how it's on line 234. I can understand how if a facility has lost a lot of their residents because of COVID or other things, a lot of them are in crisis and they're getting funding. How does this stay on? It's roughly a flat appropriation in the future. Is it one-time money for a facility that's in a crisis, or how does that work?
Senator Abeler.
Thank you, and Mr. Chair, and this is probably not all the way worked out with the department, but the idea is that given the crisis nature, this bill is all about crisis, closing and preventing harm. And talking to some of the staff, they're very interested in actually seeing how this could work. But it's money put aside to make sure that no one is turned out where they would find themselves in harm's way. There have been record numbers of closures with some, well, the outcomes aren't tragic yet, but I fear that they would be. And this is going to address that concern, and we put some money behind it. When this comes back from conference, if it actually survives, it'll be quite well fleshed out.
So Mr. Chair.
Senator Marty.
Senator Abeler, in other words, we're providing some amount, I mean, it's $6.6 million a year. Is that, assume that might go conceivably to 10 facilities? So small grants to them, but obviously depending on the need of each facility?
Correct,
Senator
and this
Abeler.
is in tandem with, we continue the emergency staffing pool for one more year as well. And for instance, they may have to reopen some closed facilities that have been mothballed. They may need to transport people. They may need some of these individuals who are needing the care, their tracheostomy requires service every half hour or so. And so there could be some real costs in some of these places. And so it would be fun if I would love that we don't need a penny of this, but I'm afraid we're going to.
Senator Kiffmeyer.
Thank you, Mr. Chair. Question I have for you is on line 704. The topic is to eliminate duplicative background studies, but it's a cost of $435,000 in this fiscal year and $692,000. So you're eliminating duplicative background studies, but it's going to cost us money to do that. That seems very odd. It seems like there should be a savings, not a cost. There must be a reason, I'm sure. Senator Abeler?
Senator Abeler, I had the same question actually written down.
Thank
here.
you. This is actually the rehabilitation costs for Senator Benson as she attempts to cope with solving this problem, which make no sense to any of us. Senator Benson can tell you much better, but this is some of the ideas that we get from those folks trying to improve things. They come up with the most ridiculous answers. So that's all the best I got.
So, Mr. Chair, Senator
Benson.
Abeler and Senator Kiffmeyer, current process, if you are a nurse who gets your license upon graduation and passing your national exam, then you go to work in a hospital. Because the hospital is licensed under MDH, the Department of Human Services does another background check. And then if you want to work casual or weekends, pick up a shift at a nursing home, another MDH licensed facility, another DHS background check. So we wanted there to be just one background check. And because the health boards are doing the licensing, but DHS wants reports and then to do a wraparound for cases of child abuse, things like that, this is what DHS is charging us. They actually wanted 4.5 FTEs, and I'm only giving them 2.5.
Well, Mr. Chair, that is just
Senator Kiffmeyer.
ridiculous. And absolutely ridiculous. No wonder this situation where you're actually simplifying and doing that, we're going to be charged extra.
Senator Kiffmeyer,
Senator Benson.
Mr. Chair, we're going to work on the simplification. We just need this to keep going forward. But every single day, we are trying to find a way to make this easier. But they wanted 4.5 FTEs. We're giving them 2.5. And I'm going to keep working on this and get it down to something more reasonable.
Senator Kiffmeyer.
Yes, well, it seems as though if you're going to eliminate work, why do you need FTEs to eliminate work?
Mr. Chair.
Is this just being just a little too
And Senator
common sense
Kiffmeyer,
and obvious?
could we have a glass of wine and I'll walk you through the fiscal code? Because this
I
is
think
how
it'll
I
take
feel
more
right
than
now.
one, but-
Yeah.
Soon we may take it to
I
the
don't
back
think it
room here.
really makes sense, no matter which way or what you have with the explanation. I think it is, if that's the case, then
Yeah, Mr. Chair.
Senator Benson.
And Senator Kiffmeyer, it does relieve some cost for the individual. Because the nurse would have to pay for 3 different licenses, or the facility would have to pay for 3 different licenses, so there is some cost savings for the individual, but we really are going to keep trying to streamline this. And Matt Burdick at the Department of Human Services has really been diligently working to get this
Senator
streamlined and
Kiffmeyer.
improved.
well, they have a long way to go. And especially when I see an ongoing expenditure of nearly $700,000, so it isn't just enough to have the 435, it grows. So I would expect at some point for this to end, and if nothing else, have a sunset. It should be systematically part of it and not an ongoing. If we're going to grow government through not doing things, we're really in trouble.
That's an interesting concept for sure. Senator Kent.
Thank you, Mr. Chair. So Senator Abeler, I really appreciate the work that is done here to address so many of these badly needed rate increases for so many caregivers, for so many Minnesotans. We've obviously had conversations about that, and I really appreciate that these are long-term improvements to long-term problems. A question I have, and I know Chair Rosen isn't in here, so I'm going to ask you, because I know you're involved with both bills. We heard a bill that Senator Housley was also involved with that had to do with a lot of recruiting grants and bonuses and that kind of thing. How does that fit with this?
Senator Abeler.
Well, thank you. And the best I can tell you is that's sitting on the floor, awaiting action.
And do you recall what the fiscal impact of that is?
Yes, 321 million.
Say it again, please.
321 million. There were 206,000 people that were given $1,000 retention grants, 20,000 people trained and recruited, as well as rate increases amounting to 110 million across the DWRS.
So,
Senator Kent.
thank you, Mr. Chair. So when that happens and this happens, both of those things ultimately will benefit this world.
Senator Abeler.
The world will be a better place then.
Thank you, Senator Abeler.
Thank you. Members, any other questions? I do have one. The chair asked me to make this point, and it certainly is a point here. 179, elderly waiver framework implementation. Can you explain that a little bit more as to what that is? And I see it doubles out into the tails for sure, but that's a lot of money. Can you just give us a little idea what that is, Senator?
Sure. Thank you, Mr. Chair. And the total of that is in the range of 116 million. Elderly waiver is a service provided in out of facilities and in facilities, assisted livings in particular, for people who have spent down to poverty, who were once living there with money and then they spend down. And the goal is to keep them in a community-based setting away from a nursing home. And so this is an area that's been quite underfunded. I cannot tell you the percentage increase. I don't know if anybody else does, but it's a significant increase to enable people to get services they need. This is in keeping with the whole focus of the bill about rates and keeping people away from a facility if they can.
So Senator, this would be private pay? When their money is depleted, then this kicks in?
That's correct.
Okay. Senator Kent.
Thank you, Mr. Chair. I have an amendment. I don't know if this is the time to offer
Well, let's
amendments.
make sure we have, I think we're going to do some commissioners yet. If that's okay, we'll do that. Somebody else have another question on the spreadsheet? No? What commissioners do you want to come up? I guess I have the list here.
All of them, Mr.
All
Chair.
of them.
PCA, I think, would like to weigh in.
Katie,
Commissioner Harpstead, I'm sure, for sure.
Commissioner Harpstead, for
Commissioner
sure,
Malcolm,
and
perhaps.
Lisa Timyon?
Timjen, she was
Timyon.
on behalf of the Department of Health, Mr.
Okay,
Chair.
and I think they might be online, is that right? Or are they here? I don't see anybody getting up, so they must be online. Commissioner Harpstead, go ahead. Welcome to the committee. Please identify yourself and go ahead.
Thank you very much, Mr. Chair. Good afternoon, members of the committee. I'm Jody Harpstead, the Commissioner of the Department of Human Services. Thank you for the opportunity to testify today on the Senate's package of HHS proposals. I want to start off by recognizing the significant investments this bill makes to support our caring professions workforce. We're especially grateful to see support for increasing PCA rates and wages, funding to continue the emergency staffing pool beyond June, as well as support for many other sectors of the direct care workforce. We're especially grateful to see support for increasing PCA rates and wages. I said that already, sorry. We also appreciate that you included changes from the governor's budget to support implementation of the Home and Community-Based Services Spending Plan. This will ensure that the important investments made last year go toward these critical HCBS services. And we're grateful for the inclusion of many of the key DHS policy and budget neutral proposals that we brought forward this session. We're pleased to see that the bill seeks to improve how MFIP works for people and supports them to get out of poverty and into the workforce. The proposal in this bill aligns well with the recommendation in the governor's budget for 6-month budgeting. We look forward to continuing to discuss how we can improve this vital employment program and how it works for people who use it. We're pleased to see the investment in the FAME program as well. Additional priorities from the governor's budget that we see as important this year: childcare is the workforce behind the workforce. If we're to tackle the workforce crisis facing our state, meaningful investment in childcare must be part of the solution. Investments in the caring professions workforce, for example, may not produce the staffing required for those services without also investing in childcare. Minnesota is in the midst of a homelessness crisis. Several counties are facing funding cliffs due to expiring federal grants, and it's imperative that we invest in addressing this ongoing problem. We would like to see investment in critical infrastructure so that DHS is able to best serve Minnesotans across the state. This includes investing in our compliance and continuous improvement efforts, IT modernization, enhancement of our direct care and treatment medical records system, and additional resources needed in our licensing division to keep up with growing demand and the workforce shortage. We're also eager to support an error-free process to support reprocessing healthcare renewals for 1.4 million Minnesotans on our public health programs following the end of the federal public health emergency. We want to ensure people do not see their services interrupted. We would like to see more in this bill to expand access to affordable and comprehensive health care, improve health equity, by making changes that, as DHS's Dr. Chamberlain talks about, build equity into the walls of Minnesota's public health care programs and ensure children do not have their health care interrupted throughout the year. Other key areas we hope to continue working on going into conference include initiatives to support tribal communities to provide culturally relevant health care, behavioral health, child welfare, and food support to people in their communities, as well as efforts to reduce the number of children entering the child welfare system while addressing the significant disparities in that system. One specific area of concern with the bill that I do want to highlight today is that DHS does not support the creation of a standalone behavioral health agency. We'd like to finish our work of hardwiring our process improvement work in the Behavioral Health Division, which is integrated with our DHS Contracts and Compliance Office. The Behavioral Health Division as a separate agency would be tiny and would have to add finance, legal, compliance, HR, tribal, county relations, et cetera. Very expensive. This would be the most complex potential split of DHS with a federal requirement of a single Medicaid agency, and even then handle less than 20% of all Minnesota behavioral health funding. Instead, we support the recently announced recovery director position in the governor's office, along with a sub-cabinet of commissioners across all of state government, collaborating to see how we can tackle the issues of addiction and recovery in every agency. We're also upgrading our DHS behavioral health director position to a deputy assistant commissioner and looking for the best talent to fill our assistant commissioner and deputy assistant commissioner positions. We've been having ongoing and open dialogue with our HHS chairs about this and other issues in the bill, and we look forward to continuing that dialogue in conference committee. Thank you for all your work and for considering our comments today. We look forward to working together over the coming weeks on all of these important issues. Thank you.
Thank you, Commissioner Herbstig. Are there any questions for the Commissioner? Okay, and it sounds like the Assistant Commissioner for Health is here and available for any questions. Okay, so we do have amendments. Senator Abeler, you've got several here.
Thank you, Madam Chair. Do you have a preference about how we do them?
Senator Benson.
Madam Chair, I have the A27.
Great. Senator Benson moves the A27.
And we'll amend it with the A35, but perhaps council should walk through the A27 first.
Thanks.
Oh, my. Okay.
We should let the HHS staff do it. Okay. We haven't had any time.
How do you-
Yeah, probably.
Isn't that whole thing?
Yeah, great. Okay.
Madam Chair.
Senator Abeler, we're going to have Mr. Monahan or whoever would like to talk first, so.
Right, they were just curious what level of detail you would like. There's probably 25 bills in here, and with the amendment, they're all policy. So they can give you whatever you want, Madam Chair.
I think it's, 248 pages, probably should have a little summary of it.
Well, they're happy.
Ms. Hoffman-Litchi or Mr. Monahan?
Madam Chair, members, starting with Article 8, Section 1, the language comes from Senate File 3470, Section 1, and it requires funds appropriated under Safe Harbor to be used only for authorized activities under that section. Sections 2 to 3 come from the A21 amendment that we heard in HSR, and it extends the transitional support to 36 months, and it also gives the commissioner discretion to extend further. Sections 4 through 8 and 12 modify the Family Assets for Independence program. Sections 9 through 11 and Section 43 updates the Homeless Youth Act and statute to include authorized use of grant funds, and it also adds a provider improvement grant program, also updates a report date. Sections 13 through 14 allows agencies to contact MFIT participants by phone or in writing, and it also modifies the income calculation for public assistance programs. Sections 15 through 39 makes various modifications to child welfare provisions, moving more towards reunification or placement with relatives. Section 40 allows welfare agencies to use data to monitor eligibility for public assistance programs. Sections 41 and 42 extend the effective date for mandatory reporting for youth recreational programs, and it also modifies the Legislative Task Force on Child Protection. And finally, Section 44 is a direction to the Commissioner to consult with stakeholders on efforts to reduce paperwork in child protection cases. Article 9 is behavioral health. Sections 1 through 4, 93 through 94, and Section 103B establish the new Department of Behavioral Health. Sections 5, 9, 13 through 17, 22, 33 through 43, 77 and 78, 85 through 87, 92, and 103, paragraphs A and C, come from, they just do some, they clean up the Mental Health Uniform Service Standards Act. Sections 6 through 8, 11 through 12, 25, 28, 32, 45 through 76, except for lines 128.7 and through 131.4, Sections 89 through 91, 95 through 99, 102, 104, paragraphs A and C, implements direct access and also adds the American Society of Addiction Medicine service definitions. Sections 10, 23, 26 through 27, 29 through 31, 76, lines 128.7, 129.27 through 131.4, Section 88 and Section 100 modifies substance use disorder workforce provisions. Sections 18 through 19 and 24 establish residential treatment admission requirements for children having a mental health crisis. Sections 20 through 21 modify the scope of allowable expenses under the Children's Mental Health Respite Care Grant Program. Sections 44 and 104, paragraphs A, B, D, and E modifies the Children's Therapeutic Services and Supports. Section 76, lines 19 through 24, allows a program that meets the American Society of Addiction Medicine care standards to bill for high-intensity treatment even if hours are modified or reduced. Sections 79 through 84 make technical changes to the statute governing coordinated care through behavioral health homes. And Section 104, paragraph A and B, repeals the Alcohol and Other Drug Abuse Advisory Council and also the Chemical Dependency Continuum of Care Pilot Project.
Madam Chair.
Mr. Monahan.
Continuing with Article 10, Sections 1, 6, 12, paragraph R of Section 14, and Sections 29 through 31 are a DHS policy proposal. These are technical corrections and repeal of various obsolete provisions. Sections 2 to 4 are Senator Abeler proposal to permit ICFDD capacity in a single-family home to increase from 6 to 8 persons and permit certain group homes capacity to increase from 4 to 5 and others from 5 to 6. Sections 5 and 9 modify requirements and state agency hearing procedures regarding basic support service terminations by 245D licensed HCBS providers. Section 7 is a DHS proposal related to the culture of safety, participant protections, and data sharing. Sections 8 and 15 require contracts between a local agency or county and a private agency to include provisions related to performance evaluations for individual case managers. Section 10 establishes a presumptive eligibility for HCBS services within the Medicaid program. Sections 11, 33 and 34 are a DHS proposal related to cleaning up the telehealth statutes. Section 13 establishes a decision review process for HCBS and long-term care determinations before denial or reduction of service. Section 14, paragraphs D and F extend options related to min-choice assessments to providers of customized living services under the BI and the CADI waiver. This option is currently already provided to elderly waiver providers. It allows them to submit nursing assessments during the min-choice assessment process. Sections 16 and 17 are a DHS proposal related to making changes to the EI-DBI policy, or policy modifications to the EI-DBI benefit under Medicaid or medical assistance. Section 18 permits additional time-limited co-signed lease arrangements between a service provider a service recipient, and the service recipient's landlord in community living settings. Section 19 and 36 modify community-directed or consumer-directed community support budget exceptions for current residents of community residential settings. Section 20 permits 6 or more hours of individualized home support with training to be billed in 1-hour units rather than 15-minute units. Sections 21 to 26 modify procedures for planned closures of residential settings and requires DHS to provide technical assistance to lead agencies when a lead agency is having difficulty finding alternative services following a provider closing a residential setting. Section 27 clarifies the meaning of excluded time for the purposes of determining the county of financial responsibility for the provision of certain services. Section 28 modifies an existing housing support moratorium exception by permitting the supportive housing units to be developed in additional metropolitan counties. Section 32 is a DHS proposal related to federal conformity for ABLE accounts. Section 35 modifies procedures for planned closure of residential settings and requires DHS to provide, I already read that. Must be related. Section 37 directs the Commissioner of Human Services to request modified reassessment requirements for HCBS services. Section 38 requires DHS to reopen a prior RFP for contracting for financial management service providers. That's the end of Article 10. Article 11 is related to DHS licensing. Sections 1 through 2 remove community residential community residential setting license requirements under 245A related to alternative overnight supervision, and instead uses the and the licensing requirements related to alternative overnight supervision technology in those settings, and instead relies on 245D licensing requirements to fill the regulatory gap. Sections 3 to 5 modify background studies and home and community-based service standards to permit the provision of out-of-home respite to children in unlicensed settings. Section 6 allows DHS to use an outside organization for data analysis provided to the Background Studies Eligibility Task Force. That's the end of Article 11. Article 12 is the Continuing Care for Older Adults article. All 7 sections are a DHS proposal related to the licensing of remote adult day services. I'll just continue right through with these. Article 13 is the Direct Care and Treatment article. Sections 1 and 2 update a reporting requirement and the transfer of committed persons, repeals enterprise activities in the state-operated areas, Minnesota extended treatment options, and the regional treatment center catchment areas. Article 14 are provisions related to the Department of Health. Section 1, I believe, is a duplicate of a provision that might have been in Senator Utke's bill, exempting certain spa pools from the regulation of as public pools. Section 2 is a different hospital construction moratorium exception that would allow critical access hospitals to expand by adding beds up to the federal limit of 25 beds without a public interest review. Section 3 modifies the definition of palliative care for the purposes of hospice care regulation and licensing. And finally, Article 15 is related to mandated legislative reports from the Department of Human Services. It modifies various expiration dates and repeals other language related to mandatory reports. That concludes the A27.
Thank you, Mr. Monahan. Senator Ingebrigtsen.
Madam Chair, I would move to amend A27 with the A35.
Okay. And the A35, Mr. Monahan.
Madam Chair, I think you would like us to walk through the A35?
Yes, that is being passed out right now.
I believe.
We couldn't make this more complicated, but we're getting it.
I believe Ms. Hoffman-Litchie will begin the walkthrough of the A35.
Ms. Hoffman-Litchie.
Madam Chair, members, would you like a line by line? I mean, I can group lines together, but.
Yeah, general,
Okay.
what we're doing here on the A35 is
Yep.
fine.
So lines 1.3 to 1.20, it just updates the Family Assets for Independence program with technical assistance provided by DHS. Line 1.21, it just removes the direction to the commissioner to reduce paperwork in child protection cases. Lines 1.22 to 1.25 and 2.2, and then 2.4 to 2.8 make minor changes to the substance use disorder provisions, cleans it up, makes some technical changes, and then along with some TA provided by DHS. Lines 1.26 and 1.27 and then 2.1 removes the language related to the creation of the Children's Residential Crisis Services. Lines 128, 1.28 to 1.29, it removes the creation of a new service, children with emerging mood disorders, that's eligible for children's mental health grants with advice from DHS. Line 2.3 and then 2.12 to 2.17, it removes moving the Children's Therapeutic Services and Supports to a complete new section. And it also removes the creation of the new service eligible for medical assistance. And then lines 2.9 to 2.11 just make some conforming changes that were adopted in state government for the creation of the Department of Behavioral Health.
Madam Chair.
Mr. Monahan.
I can pick up on page 2, line 18. All of the language from 2.18 through 3.7 is an amendment to the critical incident review proposal. And this amendment conforms with an amendment that was put on a clone that had this language that was heard in civil law. Page 3, line 8, deletes Senator Abeler proposal for modifying the contract requirements between counties and private case managers. Line 3.9 removes a proposal authorizing presumptive eligibility for HCBS waiver and alternative care within medical assistance. Lines 3.10 through the end are just clarifying language that DHS must continue to engage stakeholders when modifying the EI-DBI benefit, which is the early intensive developmental and behavioral intervention benefit under medical assistance.
And Madam Chair,
Senator Abler.
just a summary. So some of these things we're taking out aren't bad ideas. They're either, they have a cost or they're just not workable yet. So that's,
Okay.
that conforms this to make it budget neutral.
Okay, very good. Thank you, Senator Abler.
And there is an oral amendment we need to move, if we
Okay.
could, Madam Chair.
Oral
Never mind,
amendment.
after this, never mind.
Okay, all right. Senator Ingebrigtsen.
I move to amend A27.
With the A35.
The A35.
Okay. Is everybody clear on that motion? Yeah, clear as mud again.
Very clear.
All those in favor of the Senator Ingebrigtsen motion, please say aye.
Aye.
All those opposed, nay. Motion prevails. Okay. Now, Senator Abler.
Okay. And Madam Chair,
Yes.
I'll let
Senator
Mr.
Abler.
Monahan say it. They
Mr.
seem to
Monahan?
have a tone that serves well for television and understanding.
I think I gave it to you. Oh.
So we have A35 before us.
So Senator Abeler is requesting that the following oral amendment be made to the A27.
Oh, 27. Do we still do that?
Page 150.
Yep. This can be incorporated if into Benson's.
Section 101.
But she's not here.
Page 150, delete section 101.
Page 150.
Yeah, right here. Okay. And Senator Abler to this oral amendment?
I'll just defer to council.
Mr. Monahan?
This is a result of a drafting error when we created the A27. Senator Abeler had asked us to remove it. We didn't do that. It is removing a direction to the commissioner to find a way to create a Medicaid service to provide mental health benefits to people who, to older adults who have been committed, civilly committed.
Madam Chair, I move that oral amendment.
Senator Ingebrigtsen moves the deletion of section 101 on page 150 of the A27 amendment. All those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. And now we have the amended A27 before us. And the motion is before us. Senator Marty?
Madam Chair, not an objection to the amendment, but on page 224, we're amending the hospital licensure moratorium again, and I'm just curious about this one. I'm not sure which project this is, but the Senate seems to have a mixed feeling that this is a really good process, and but then we have to override it every time. Just curious what this particular hospital project is.
Senator Abler?
Well, thank you. This came from Senator Bach, and it has to do with rural hospitals and being allowed to actually function in a way that makes sense. It's on page, as you said, 224. And it's for small hospitals, and it's allows them to transfer between nursing home beds and hospital beds. And it actually has the effect of keeping maybe 11 places open. And it didn't seem like this made sense. For all the other topics you've been through, this didn't make sense to go through a public interest process. It just seemed to make sense to help in a time like this.
Senator Marty?
Madam Chair, I think it's
Senator King?
Thank you, Madam Chair. I would just say I've met with the folks from Cook County General Hospital, which is part of what has driven this. And they just have such limited flexibility because they are such a smaller facility. And this will really give them an important way to manage their resources. So, thank you.
Thank you, Senator Kent. Okay. Just vote on this now. Okay, that was a question. Now we have the A27, amended A27 before us. Senator Benson.
Madam Chair, we move the A35?
Yep.
Okay.
That's
So-
in place, and
Madam Chair, I'd move the A27 as amended.
thank you. On that motion, all those in favor, please say aye.
Aye.
All those opposed, nay. Motion prevails. Amendment is adopted. Okay, Senator Benson.
Madam Chair, the A28.
Senator Benson makes a motion on the A28. Handing it out right now. Senator Benson, hold on.
Madam Chair.
Yes, Senator Abeler.
While they're coming, this is the one that changes all the money around with all the work you've done since the committee. And staff, when you get to it, will be happy to walk through it. This is an amendment that actually relates to everything this committee is about. There's money here, money moving. So, thank you.
Senator Abeler, do you need Ms. Hoffman-Leachy or Mr. Monahan to walk through the A28?
Madam Chair, I absolutely do.
Okay. Who would like to go first? Ms. Hoffman-Leachy? Or is it-
Madam Chair, I'll begin.
Okay, Mr. Monahan.
Okay. Starting on page 1. Page 1, line 2 through line 7, and also lines 11 and 12 are all technical changes related to the proposal for closure prevention grants. And then those intervening lines, page 1, line 8 through line 10, modify the closure prevention grants program by including an additional setting among the eligible settings. And in particular, these are settings that, a small group of them that are exempt from assisted living licensure, but are authorized to provide customized living services. And they weren't included in the original version of the language, mostly because I always forget that they exist. Page 1, line 13 and 14 are technical changes related to effective dates. You're going to see that one a lot. Page 1, line 15 through 26. This replaces the initial proposal in 4410 that had a sliding scale for the enhanced rate for PCA services, and instead just raises the rate across the board for anybody receiving more than 10 hours of service. And it, depending on how you look at it, it increases the existing enhanced rate by 33%, or it increases the base PCA rate by 43% for those services. Depends on how you count. Page 1, lines 27 to 29 are more technical changes to effective dates. We now have a very, very long set, about 10 pages. Page 1, line 30 through page 10, line 16 are all the results of technical drafting errors related to trying to amend session law that passed this session. And we messed it up for technical reasons. So you can just skip on to page 10. Page 10, line 17, makes a number of changes to the ICF-DD rate increase proposal. A clarifying change to specify that the change in the rate is a change to the operating payment rate. That's to conform with the fiscal note. Page 10, line 18 through 28 is similar to one I just discussed. This is the enhanced rate for people receiving more than 10 hours of service. But this language is for the CFSS program, which
is going to replace the PCA program any day now, they say. Page 10, line 29 is another technical change to an effective date. Page 10, line 30 through page 11, line 3 are technical changes clarifying the language involving the repeal of the county DT&H grants. Page 11, line 4 is a technical change. So is page 11, line 5. That's related to this drafting error related to current session law. Page 11, line 6 is a technical change to an effective date. Page 11, lines 7 to 9 adds an extended expiration date to a mandated legislative report so that it exists beyond the relatively new statutory expiration for all mandated legislative reports. Page 11, lines 10 and 11 are again related to the technical drafting error with respect to this session law. Line 12 is a technical change. Lines 13 to 14 conform the language to the spreadsheet related to community-directed community support budgets for, again, the enhanced rate we talked about with the PCA and CFSS program. Page 11, lines 15 through 29 conform the language to the spreadsheet with respect to rate increases for certain home care services. Line 30 is technical. Page 12, lines 1 and 2, again, are technical changes related to shared services under the disability waivers. Lines 3 is technical. Line 4, the deleted sections remove appropriations that are going to show up as riders in an appropriation article that you're going to adopt later this afternoon. The rest of page 12, all the way to 13.7, conforms the language to the spreadsheet by directing the commissioner to further increase DWRS reimbursement rates beyond what is otherwise in the bill. Page 13, line 18, removes two appropriations that again will appear in a later amendment. Lines 19 through 24 are all technical. 25 to 26 are technical changes related to shared services under the elderly waiver. Page 13, lines 27 through page 14, line 19, are all changes to conform the language to the elderly waiver rate changes as reflected on the spreadsheet. Lines, or page 14, line 20 through page 16, line 16, conform the nursing facility per diem sort of add-on proposal to match the spreadsheet, and also makes a number of changes to the distribution plan requirements. Page 16 now, lines 17 and 18 are technical. Page 16, lines 19 to 21, make changes to the elderly waiver rate proposal to conform with assumptions that were in the fiscal analysis. Page 16, line 22, first deletes a repealer related to the old version of the elderly waiver rate increase proposal, and then includes two provisions from Senate File 2784 that are currently on the floor. One of them is related to expedited re-registration for nursing licenses that have lapsed, and another is related to staff training requirements for unlicensed staff who are working in nursing homes and other long-term care settings. Getting close. Page 18, lines 4 through 6, make some clarifying changes related to the MA-EPD premiums proposal. Page 18, lines 7 through 9 are conforming changes related to NEMT rates in order to match the spreadsheet. Page 18, lines 10 through 16 are some technical assistance from DHS and the revisor related to the NEMT and ambulance fuel increase. I don't know what it's called. Adjuster, fuel adjuster, I think that's what it's called. And page 18, line 17 removes old language related to the NEMT rate increase that is substituted by the language above. And I will pass it off to Ms. Hoffman-Litchie at this point.
Madam Chair, members, page 18, lines 18 through 21 makes technical changes to the language that's creating the Department of Behavioral Health. Page 18, line 22 through page 19 page 19, line 16, it makes a conforming change to the language that expedites the award of grants from compulsive gambling that's currently in Senate File 4410. Page 19, line 17, removes a comma. Page 19, line 18 through page 20, line 11, it removes the appropriation language that will hopefully be adopted into a new appropriations article, and it also adds in establishing a grant language for those specific appropriations. Page 20, line 12 makes further technical changes. Page 20, line 13, it removes the reallocation language for the previously appropriated funds for the homeless youth shelter improvement grants that are currently in the bill. That will be moved into a new appropriations article. Page 20, line 26 through 27, it removes the hold harmless language from the FTE full-time employee calculation for the child care stabilization grants. Page 20, line 28, it removes the appropriation language for the Family Assets for Independence program. That will be moved into the new appropriations article. Page 20, line 29 through page 21, line 2, it makes technical changes to the healthcare worker platform background study proposal. And then page 21, line 3 through line 15, it moves the employment requirement for substance use disorder providers and homelessness providers into statute.
Very good, thank you. Ms. Hoffman, any questions on the A28 amendment? Okay.
Madam
Senator
Chair?
Benson renews her motion. Yes, Senator Benson.
Madam Chair, I'd just like to make note on page 15, line 12, I'd like at some point to understand state and federal unemployment taxes are included in the allowable use for the funds. And so at some point, I'd like council to let me know if the fact that the House hasn't passed the unemployment funding, if that impacts how much can actually go to employees in nursing homes as we're doing this rate increase, but not for today. We have enough to do.
Duly noted. Thank you, Senator Benson.
Madam Chair, I'll move the A28.
On that motion, Mr. Monahan.
Madam Chair, Senator Abeler would request an oral amendment to this before it is voted on.
Okay. Senator, Mr. Monahan?
The oral amendment would be to amend the A28, page 12, line 11, delete 225 million. And insert 253,001,000.
Okay.
And this is to conform with the spreadsheet. This is related to the DWRS rate increase.
Can you please direct us to where that is at in the spreadsheet?
It's right on the first or second page.
Yeah, page 3.
Page 3.
123, isn't
It should reflect the 3-year appropriation.
Mr. Monahan, what was that figure again?
41.
253 million, 1,000.
1,000, okay. Mr. Nauman has his calculator out.
Perfect. Good job.
Yes, okay, good. Any questions on that?
Madam Chair, I'll incorporate the oral amendment into the A28.
Senator Marty. Thank you, Senator Benson.
Just a question on this, because it's kind of unusual language where we direct the commissioner to raise the rates to the equivalent of whatever the appropriation is. Is DHS, have we done that before to them?
Senator Abeler.
Well, thank you, Madam Chair. Senator Marty. Part of the challenge is getting fiscal notes. And so we wanted to absolutely have this, at least especially the big items, totally squared away. And I think they are given language like this, we can go up to that number and not exceed. And so that's why we're confident that we've achieved the budget priority numerical thing.
Madam
Senator
Chair,
Marty.
it seemed unusual, but I understand why I'm not complaining. I'm just surprised to see it, but okay.
Okay, all right. On Senator Benson's oral amendment to the A28. All those in favor, please say aye.
Aye.
All those opposed, nay. Motion prevails. The amended A28 is adopted. Okay, Senator Benson.
Thank you, Madam Chair. Next, I have the A33.
Senator Benson moves the A33 amendment.
And I'm going to ask Mr. Monahan if I should move the A38 before he starts his description.
So the A38 is amending the A33, so.
Correct.
Okay.
So, yes.
So A33 is getting passed out right now, and then we'll have the A38.
And then the A38, Madam Chair.
Yes, Senator Benson. Yep.
Thank you.
Right. To the amendment, please, Mr. Monahan. Or is it you or?
Well, sure, Madam Chair.
Or Mr. Albrecht? Who's doing this one?
So this amendment is the standard appropriations article that's typically in a combined health and human services omnibus bill. So it includes all of the appropriations that are in Senator Utke's bill that you heard earlier and laid on the table, as well as all the appropriations in the bill you're currently considering, as well as the handful of fiscal items that were in Senate File 4165 that then became the A27 that you amended on to 4410. So the numbers in here are all the numbers Mr. Albrecht already went through on the spreadsheet. The riders should reflect the items that require riders that have already been explained by Mr. Albrecht.
It's fine, unless there are questions. But, Mr. Monahan, we do have the A38 that amends this A33. What would you like, how would you like that to be done?
Amended on?
Madam Chair, I'll move the A38.
Senator Benson moves the A38. Thank you. Okay, so that's just the Board of Behavioral Health and Therapy, 43,000 in fiscal year 2023. And delete 157,000 and insert 200,000. Okay. Are there any questions on the A38, members? So Senator Benson, you'd like to move the A38 onto the A33 amendment, correct?
Yes, Madam Chair.
On that motion, all those in favor, please say aye.
Aye.
All those opposed, nay. Motion prevails. Now we have the amended A33 before us. Members, any comments? Senator Abeler, any thoughts? Anything? No?
It's a good amendment.
It's good. It's a very good amendment. Senator Benson, would you like to move the amended A33?
Madam Chair, I'll move the A33 as amended.
On that motion, all those in favor, please say aye.
Aye.
All those opposed, nay. Motion prevails. The amendment is adopted. Okay, so now the bill is in order. Is that correct?
Yes, Madam Chair.
Okay, wonderful. Amendments. Okay, Senator Kent.
Thank you, Madam Chair. I would like to offer the A36 amendment.
Senator Kent moves the A36 amendment. Is it complicated or fairly simple?
Well, I think
Can
it's
you start?
I think it's fairly simple. Yes, I'm happy to start. Yeah, anything to keep this train moving.
Right.
Madam Chair, I appreciated some of what Commissioner Harpstead talked about in her testimony. I think, as has been the case with a number of things, I think there are a lot of great things in this bill, but there are some, I think, big glaring holes, and one of them is childcare. We've talked about this before. Childcare was challenging. I used to get meetings with business organizations from across the state, and they would all talk about how it was just a real problem for their businesses that there were not more childcare options for their workers. And then, as is the case with so many other things, the pandemic came and made a problem, a bad problem, that much worse. So, and just to reference what Commissioner Harpstead said, I thought it really summed it up well. Childcare is the workforce behind our workforce. And it's important for our kids, it's important for our families, and it's important for our businesses and economy. So what this amendment does, the A36 amendment, is expand CCAP, and bear with me while I regroup here for just a second and grab something. It increases the number of families who are eligible for child care assistance by allowing foster care families, custodians, and guardians to access financial support for child care. Minnesota is only one of 6 states in which foster families aren't eligible for child care subsidies. The high cost of child care creates a financial barrier for people becoming foster parents, particularly those who might be on fixed incomes or don't pay enough or don't earn enough to pay for child care, as well as being problematic for keeping sibling groups together. It sets our CCAP reimbursement rates to the 75th percentile of the most recent market survey. This not only aligns Minnesota federal recommendations in other states, but would draw down significant federal funding to help pay for the increase. And that has been a recurring theme in a number of ways in this committee with these bills, Madam Chair, to make sure that we can maximize the resources available to us from the federal government. The one-time COVID-related child care funding that we passed last year just isn't enough. Increased rates will incentivize more providers to enter this program, expanding options for families who use it. And finally, it permanently changes prioritization criteria for the CCAP basic sliding fee program to reduce waiting lists and make sure more families receive financial assistance. We temporarily changed the waitlist prioritization settings last year until 2024 and have seen thousands of families taken off the waiting list across the state and receive financial help as a result. If we don't make this permanent, counties have said that they will need to put families back on a waiting list in anticipation of funding shortfalls, since this is not a forecasted program. And just to sum up again, according to the Pew Research Center, 48% of parents with kids under 14 who quit a job in 2021 cited child care issues as a reason for leaving. We just know that this is a huge opportunity to help our kids, their families, and our workforce and our businesses and economy. And so this is one thing that I think we could really do in this area that would make a huge difference to Minnesotans moving forward. And so, members, I would encourage you to support the A36 amendment.
Thank you, Senator Kent. Senator Abeler.
Well, thank you, Madam Chair and Senator Kent. And we actually all share a concern about accessibility for child care and so on. And last year we were pretty happy we were able to increase from 25th percentile. The governor asked for 30. I actually went home with 30 on the older kids and 40% on the infants and toddlers. We have since then spent close to $500 million in grants that are still ongoing to these providers on a budget that used to be like $250 million a year. And so, Madam Chair and Senator Kent, I think this is an appealing amendment. I do know that it probably costs at least several $100 million, the 75th percentile, and I know the sliding fee reprioritization, which we heard itself costs $25 million, I think, a year. Madam Chair, I'm not sure how your rules are. I'm not sure if the infrastructure, if the what do you call it, the shock absorbers and the undercarriage of the piece of legislation I'm carried is enough to carry this particular amendment. So I don't know how you handle amendments that are like far in excess of the budget priority number we've established. So, but I'd have a hard time voting for this today, even though I don't get a vote in this committee anyway. Thank you, Senator Kent.
Thank you, Senator Abeler. Thoughts? Senator Kent renews her motion on the A36.
Madam Chair, a roll call, please.
Roll call requested, roll call granted. Ms. Johnson, please take the roll.
Chair Rosen?
Chair votes no.
Vice Chair Ingebrigtsen?
No.
Senator Marty?
Strongly aye.
Senator Benson? No. Senator Champion?
Aye.
Senator Johnson?
No.
Senator Kent?
Aye.
Senator Kiffmeyer? Senator Lopez Franzen? Aye. Senator Pratt?
No.
And Senator Kiffmeyer.
There being 4 ayes, 5 noes, the A36 is not adopted. Senator Marty.
Madam Chair, I have a A32 amendment.
Senator Marty moves the A32 amendment.
And Madam Chair, this one's very easy one to deal with, Senator Abeler, in terms of cost. This is very, very little cost. This is one that, because the federal government has enabled us to raise the SNAP allowance to 200% of poverty line, that this would do so. I believe the only cost to the state is the computer programming cost, and I think it brings in like 30 or 40 million of federal funds every year. I can't be precise about the exact number on it because I'm not sure what it is, but I do know we've been talking about how many people strapped by COVID and higher food prices and everything else are struggling. And last year, the Hunger Solutions brought in a couple from northern Minnesota, retired couple who were saying they had made careful retirement plans and they hadn't figured quite right, and they were struggling to do it. We heard from people who are single parents who are struggling to put food on the table, and this is one, basically the federal government saying, we know people are hurting, we know they need the help. This committee's made a priority of trying to maximize federal dollars, and here, other than computer programming costs, they're handing us the money to use for people who are very struggling to put food on the table. So I strongly urge members' support for this, because it's basically, in terms of a $1 billion bill, I mean, a few $1,000s for computer programming is pretty small potatoes, and it's a pretty good thing to do. So I urge your support.
Thank you, Senator Marty. Senator Abeler.
Well, thank you, Madam Chair and Senator Marty, and we've actually discussed this a fair amount. I don't know, I mean, it sounds appealing, but I don't know, if I were going to vote today, I would vote no. We took it to conference, we talked about this, so that's just my thoughts on it.
Senator Marty.
Madam Chair, roll call on this. I just think we're taking people who are struggling to put food on the table and we're saying we're not going to accept help for them. I know the majority leader has an annual, and Senator Bach have had annual drives for food shelves. You know, this is a more consistent, easier, fairer way for people to get food they need on the table, and I think we appropriately have tried to maximize federal dollars we've gotten from COVID and so on, but why we would turn down this for some of the most vulnerable Minnesotans, I have yet to see any even half-baked arguments against doing this.
Roll call requested, roll call granted.
Chair Rosen,
Chair votes no.
Vice Chair Ingebrigtsen,
No.
Senator Marty,
Aye.
Senator Benson,
No.
Senator Champion,
Aye.
Senator Johnson,
No.
Senator Kent,
Aye.
Senator Kiffmeyer,
No.
Senator Lopez Franzen,
Aye.
Senator Pratt.
No.
There being 4 ayes and 6 noes, the A32 is not adopted. Further amendments?
Yeah, I think there's one more. Yeah.
Senator Lopez Franzen.
Thank you, Madam Chair. I have the A39 amendment.
Senator Lopez Franzen moves the A39 amendment. Should we wait, or is it fairly easy? Is it posted yet? No,
Not sure.
not posted yet.
I don't have it in front of me either.
Thank you. Senator Lopez Franzen.
Thank you, Madam Chair. It's a simple amendment in terms of funding for a program that is already included in the bill that Senator Abeler has, and it just needs the funding. And I know you've made some changes to it that I think are appropriate. This is including more funding for, from general fund to the homeless youth grant program. It's been in law for a long time now, and we know that the increase in, along with the food assistance that was just mentioned, on my way to work today, I was listening to the news and how we're supposed to adjust our budgets, and a lot of people who are in fixed income, especially our seniors, have had to just budget for more expensive groceries and so forth, and people who are now in the homeless youth population are just going to have a harder time, and we need to acknowledge that. It's only going to get worse in terms of the ripple effects of having, or a lack of having a home, and this is money that I think it's well spent for our economy in terms of giving youth a place so they can call home. It also amends it. It's a $10 million a year to homeless youth grants, so it's a competitive grant, and I've had some success stories in my own district when this funding works and the community acknowledges that it's better to have our youth housed than it is to have them committing violent crimes that we've seen in our communities, especially mine as of late. So this is just one piece of the puzzle, again, that needs to be addressed and with some funding to it. So I appreciate your indulgence, Senator Abeler.
Thank you, Senator Lopez Franzen. Mr. Nauman.
So, Madam Chair, I think you wanted me to speak to the price of the overall amendment. There's $50 million in fiscal '23, but under budget rules, that would also carry forward into the tails. So there'd be $100 million in tails, so the total price would be $150 million over 3 years.
Thank you, Mr. Nauman. Senator Abeler.
Well, thank you, and, you know, Senator Franzen, you know that you found a soft spot with me on this topic. I'm active in my community with a center, and so it's an important topic. And so the topic of the bill that we just did with that $1 billion is important as well. And if there were an infinite amount of money available, which in this committee there seems like you can spend all you want, at the end we have to reconcile all the choices that both sides are going to be making. And so I am nervous if this went in the bill, that actually the amount of work we're trying to do to help the people with disabilities and seniors and the frail folks who were so much in harm's way would actually likely be diluted at the end of the day. And I know this will be discussed in conference to some extent. I don't know where the money lands at the end. And so I'm sympathetic and friendly, but I think just if I was going to vote on this, I would vote no, with all respect. Thank you.
Thank you.
Senator Lopez Franzen.
Madam Chair, and thank you, Senator Abeler. And I think we're like-minded when we know that this is not just a population that's homogeneous and monolithic. It's people who also have some mental health supports needed and some other supports. So we tackle one silo without the other, and I just hope that this does get more further discussion in conference. I am asking for a roll call, but I think this is an important signal that we are not just tackling one population, that we're thinking about all of us in Minnesota, especially our youth, that is who we expect to be contributors to help the seniors also have supports as they grow into that phase of life. So I think we have to think about the entire continuum, and I appreciate the indulgence. Thank you.
Thank you, Senator Lopez Franzen. Roll call request, roll call granted. I will note that many of us have had our fingerprints on this issue for the past. Senator Dibble has worked very hard. I've worked alongside with him, to you, Senator Abeler, everybody. So this is very important. However, again, this is not a budget year, and it is something that will be addressed. We were just trying to look in our fiscal review, popular book, how much the program was funded last year, and couldn't quite get my hands on it fast enough. But it is a very important issue. I do think that this is an issue, a topic, an appropriation for next year. With that, Senator Marty.
Yeah, Madam Chair, I'm just puzzled by this because we keep saying it's not a budget year as we appropriate money. Senator Abeler's bill has a lot of good provisions in that I very much like, and he was told he can only spend whatever target he has or priority he has or whatever terminology we're using. But this committee has the ability, as Senator Abeler pointed out, the ability to set what those targets are. And since we don't have targets, it seems to me that saying, well, this isn't a budget year, next year, do you think, Senator Abeler, you think there's going to be 50 million for homeless youth next year? I mean, I'm just trying to get a sense from people, because it's a weird kind of a game. We're putting this much in, but we can't tell you how much we're going to put in over here and nothing else. So the public and we as minority party members don't know until you come up and say, well, we can include this, but we can't include this. But 50 million, everybody says they appreciate Senator Dibble's good work on this, but, well, we can't do it because it's not a budget year. Well, what have we been doing the rest of the day? Appropriating money. And it seems to me that when we have money in the bank, ongoing money, saying that this isn't going to be done this year because it's not budget year, we're basically saying homeless youth aren't our priority, regardless of what we're telling Senator Dibble and others. So that's what my pitch is. Senator Abeler, do you really think there's going to be 50 million next year if we don't do it this year?
Senator Abeler.
Well, and I appreciate the discussion. I don't remember what we did last year. We did a considerable increase in homeless funding for last year, which I don't even think has percolated through. And Senator Marty, I can only reply to the constraints you felt when you held the gavel. And there's many things that you would have liked to have invested in the areas you were overseeing and the areas that you weren't overseeing. But if I had to pick a priority that's compelling to me, it's the collapse of the long-term care industry, and people were unable to help themselves. And in the bill, we did a little thing trying to help draw some of those folks into the workforce in association with some of the homeless work. But, you know, I can do the best I can, Senator Marty, so thank you.
So Senator Abeler and Senator Marty and Senator Lopez Franzen, the veterans, we gave 6.3 million per year last year. And last year in the tax bill, 20 million beginning in FY 24 through 29 for homelessness prevention aid to counties based on a population and the county's proportional share of students experiencing homelessness. So there was a significant focus on that.
Madam Chair.
Senator Marty.
But on that, I mean, there was a group outside this noon talking about homelessness, and they had a woman who looked like she was early 70s talking about how she was struggling to find housing and just unaffordable. And so the fact that we've done some things last year for homelessness, we're maybe doing a little bit here and there, we've still got a huge problem. And people, 70-year-old woman talking fear of how difficult it is and begging friends and anybody she can talk to about how I can find money to pay rent, because she finally found a place that she could rent for $250 a month more than she had been paying and more than she could afford on her Social Security or whatever. It seems to me that maybe that ought to be, and youth homelessness ought to be a priority, not what we've done in the past or not what we're doing now, but saying that we can't afford to do it now at a time when we're saying we have a surplus, which means extra money. I think we're effectively saying, well, we do care about youth homelessness, but not enough to do something. That's what I'm trying to get a handle on. And this one, I know, I mean, the last amendment, I still haven't figured out that one, because nobody will give a straight answer on why we can't take federal money to address people who are hungry. But this one, it costs $50 million, but it would make a real difference for homeless folks. So, Madam Chair, I'm frustrated that the majority says this is not on the table, and we still haven't, we're not going to see a budget. I've understood that, because you say it's not a budget year, so we just keep appropriating money in various accounts and never talking about a budget because it's not a budget year. And I don't get the logic of that, but because that's troubling.
Thank you, Senator Marty. I would be interested to know how much we spent through our COVID money on homelessness. I know a tremendous amount has, and I am anxious to get our hands around those figures too. So, and Senator Marty, a roll call requested. Roll call granted.
Chair
questions? Oh, yes, Ms. Johnson.
Chair Rosen,
Chair votes no.
Vice Chair Ingebrigtsen,
No.
Senator Marty,
Yes.
Senator Benson?
No.
Senator Champion?
Aye.
Senator Johnson?
No.
Senator Kent?
Aye.
Senator Kiffmeyer? Senator Lopez Franzen?
Aye.
Senator Pratt?
No.
And Senator Kiffmeyer.
There being 4 ayes and 5 noes, the A39 is not adopted. Any further amendments? I have the A40 amendment I'd like to move. It is posted. This is an amendment, members, that, a bill that came in very late, and it is something that's highly supported from a good friend of mine, the retired Chief Justice Kathleen Blatz, dealing with the way we treat children when they're being interviewed for abuse. And it's called Maya's Law. I am going to make an oral amendment at this point to take out, on page 3, line 29 through 32, that deals with the civil and criminal liabilities, which would make it go to civil law, which we're going to have to do. But basically, when a child welfare agency receives a report of maltreatment, they are assessing and investigating it, and the children are sometimes there, or most of the time are there with their perpetrator. And in the case of domestic abuse or any other abuse cases for adults, they are not in the room with their alleged perpetrator. So this would increase the safeguards for children in their interviews through their family assessments. And I think it's just very important. It would add to all the work that we've done in the foster care area and in the area of child protection, which I have for many years been the chair of that commission, but I believe the gavel has been passed on. But it's an area that I know I can't imagine a young child having to sit there in front of their alleged offender and have to explain the truth in front of that person. So basically, we're protecting this child. Senator Abeler.
Well, thank you, Madam Chair, and I have a lot of regard for Justice Blatz, and I think it's a good amendment, and I would be happy to see if we can get it across the finish line. So I would, if I was voting, I would vote yes. Thank you.
Thank you. I appreciate that. Senator Abeler. Any questions on the amendment? Senator Marty.
Madam Chair, again, I think it's a great amendment. It strikes me that way, but I do feel it would be better to have these amendments handled in the appropriate committee first. But I understand the situation. I think it's a terrible one that we've allowed those to happen. So I support the amendment. I just think it would be better if today seems to be a Health and Human Services Committee day rather than a Finance Committee day. But I support the amendment, just observing that would be better in the other committee first.
Thank you, Senator Marty. And yes, I think we just ran out of time in your committee, Senator Abeler, basically. And I know Representative Becker-Finn has the bill on the other side. So we are working hard to protect the children. With that,
Madam Chair?
Senator Benson.
Is the interview of the child outside the presence of the parents if the parent is suspected, or what is the boundary for a child 4 or over to be interviewed outside the presence of their parents?
There must be I know there is, where is this? It has to have exceptional circumstances must take place prior to any interviews. So there has to be exceptional circumstances that are reported for that interview to happen.
So, Madam Chair, I think what it actually says is, other than exceptional circumstances.
What page are you
It must
on?
take place. Page 2, line 6.
Oh, I got the bill. I'm sorry.
And then for a child who's 5 years old, the parent isn't in the room. Is that only if the parent or a relative is considered an offender, or is it always outside the presence of parents?
Well, basically, the child can be interviewed without the parents' or the guardian's permission if there is an alleged allegation, as I read it.
It's, a child's interview may proceed without a parent or guardian permission. Okay, an interview of a child in foster care over 4 years of age must take place outside the presence of the child's foster parent or parents. So the child's always separated from their parents regardless, it appears, regardless of if the parent or foster parent is alleged to have abused the child.
Must take place outside the presence.
That's what it looks like to me, Madam Chair. So a 5-year-old would be separated from their foster parent or parent to be interviewed about abuse, right?
Would you like to have that piece taken out, Senator Benson? Line
Madam
214.
Chair, or at least make it a may. I am concerned that a 5-year-old would be with another adult talking about a traumatic event and the parent have no ability to be in the room.
Well, that's the issue, is that they are in the room and they are the ones that are perpetrating.
Does it, please guide me to the language where it says the parent, if the report alleges, I'm trying to figure out where it says that the parent is, obviously, if the parent is the one perpetrating the abuse or even a close relative of the parent, I think some separation might be warranted. But if it is another adult, non-related, I would be very concerned about having a 5-year-old interviewed without their parent.
So on page 1.8, if the report alleges maltreatment that presents a significant safety concern. So it has to be a significant safety concern. So perhaps this is something that needs a little more work. Would you rather have?
Madam Chair, I am concerned about 5-year-olds being separated from their parents until I have a better understanding of this language. And obviously, if the parent is the perpetrator or a close relative, then there needs to be some separation. But if a child's already been traumatized, having a parent or foster parent there might actually be supportive of that child.
Madam Chair?
Yes.
Madam Chair, isn't that the point that you're trying to make here, is that if the alleged perpetrator simply cannot be involved with the interview, and if that happens to be a parent or a legal guardian, obviously you don't want them to be interviewed in front of the alleged perpetrator.
Right. Under significant safety concern.
Absolutely.
And so that's what we're trying to get at. Senator Kiffmeyer.
Thank you, Madam Chair. The concern I have here is that what if the alleged maltreatment is being done by the primary caregiver? I have an instance in my district where that's what was happening. And when this provided a significant challenge because it was a child and the grandmother made the report, but because of the situation and it was that child's primary caregiver, the child was put in an untenable position because of that.
Right, but that's what we're trying to do. That's what we're
Right.
trying to get after, is that they feel they're in a safe spot where they can discuss what happened without the
Perpetrator.
available, right. So the local welfare agency must document the information collected under 2.20 related to the completed, there must be a family assessment in the child or family's case notes. So there is a backup there.
And
So, you know what?
Madam Chair, I do agree with paragraph B. The interview must take place outside the presence of the alleged offender, and must take place. I get concerned if the parent isn't the alleged offender, why can't the parent be present for their 5-year-old going through this? And I have no background on this, so I don't know the story that's causing this language to emerge.
Well,
Madam Chair,
yes, Senator Abeler.
since I would like to welcome everybody to the Human Services Committee. If you all can't be there, now you get to enjoy. For the purposes of today, and perhaps just a suggestion, if you just delete the new language on paragraph C on line 210 and the new language on 214, this will give it a placeholder for the discussion through conference. If this language is that important, we can add it back in, but that way we will do no harm to families. But I think the key part is, Senator Ingebrigtsen mentioned, was you want this interview to be by itself, and maybe the meat of the bill is really 2.6 to 2.9. And then we can sort it out and people can weigh in, and that way I think that's safe, and this will create quite a bit of discussion, Madam Chair, that I will get to be part of, and you too, I'll drag you in there, Madam Chair, so thank you.
Thank you, Senator Abeler. Senator Benson, does that
And it would make me
suffice?
feel better. I know you want to move this language, but I would feel better if we had more time to work on parents being separated from kids.
The consequences.
Thank you.
Okay. So I'd like to also amend orally to take out paragraph C and D on page 2, line 2.10 to 2.15.
And Madam Chair, just to clarify, so you're reinstating the stricken language on 210? I mean, you're keeping that?
No, I'd just like to, Mr.
cross.
Naumann, I'd like to just take out the new language. Yeah, and not reinstate the old language, right? Okay? B, no. D, O, D. No, we'll delete that too. Okay, does everybody, Mr. Bodden, are you clear on that?
Madam Chair, I think it might be helpful to restate the amendments that you would like to incorporate in the A40 amendment. My understanding is on page 2, line 10 of the amendment, you want to keep the stricken language in place, delete the new language on lines 12 and 13, and lines 14 and 15 on page 2. And that would be in addition to the earlier amendment that you offered, which would, that deletes section 7 on pages 2 and 3.
Right, thank you. Any questions on that? I know, Senator Marty, you got that look. No? Yeah, okay. I appreciate that, Senator Abeler. If we can just keep this alive, we'll continue to
Thank
work
you.
on it. Yeah.
It's a worthy project, Madam Chair.
Okay. On the amended A40 amendment, members, all those in favor, please say aye.
Aye.
All those opposed, nay. Motion prevails. A40 as amended is adopted. Any further amendments? Final comments? Oh, I'm sorry. who has one? Senator Kiffmeyer, do you have an amendment?
No, Madam Chair.
Okay. Any final comments?
Madam Chair.
Senator Abeler.
I want to thank the committee for their attention to this, and I do appreciate the challenge we face as we have to make some choices here. But I wanted to particularly just single out the staff. They actually know every word of this, and not just in our committee, but I think we have the best. But we have just remarkable nonpartisan staff, and partisan staff too. But these nonpartisan folks, they work day and night, and just so impressed and happy for their assistance doing our important work. Thank you, Madam Chair.
Thank you very much, Senator Abeler, for your work on this and your passion. You're very passionate about this issue that, as you say, this whole industry is collapsing, and it's in dire need of some assistance and shoring up, so. Senator Ingebrigtsen.
Madam Chair, I have two motions. The first one, I move that Senate File 4410 be amended to include the contents of Senate File 4198 as amended, and that staff be instructed to make the necessary technical and conforming changes.
On that motion.
Madam Chair,
Senator Marty.
could I amend that motion to accept all of 4198 except for sections 11 and 12 on page 36 through 50-something? That's the nice nurse licensure compact, and I think there's a lot of good stuff in Senator Abeler's bill and would love to support the bill, but I have problems with putting this policy language in here, and we've already passed this on the Senate floor, so that provision is still alive. So, Madam Chair, I'd like to amend Senator Ingebrigtsen's motion to take all 4198 except for sections in 11 and 12.
Senator Abeler.
Actually, Madam Chair, this is part of Senator Utke's part of the bill, and my personal opinions aside, I think he would like it to stay the way it was. He and I don't quite agree on this, but it's, thank you, that's my comment.
Sections 11 and 12,
Mr. Nowman.
Madam Chair and Senator Marty, to clarify, we were just quickly scurrying to grab Senate File 4198 as it was laid on the table. I think you were talking about Article 3, Sections 11 and 12, the nursing compact?
Yes, Madam Chair, Mr. Nauman, yes. It's Article 3, Sections 11 and 12.
So, Madam Chair, as I understand the motion, it would be to bring in Senate File 4198, as Senator Ingebrigtsen said it, with the exception of those of Article 3, Section 11 and 12. And I'm just restating it so that everybody understands what's being discussed. And if I got that wrong, Senator Marty, I know you'll correct me.
I'm having a little trouble hearing you, but yes, it would be to incorporate 4198 except for those two sections of Article 3.
I think we understand the motion.
Okay, does everybody understand this motion by Senator Marty? Okay. All those in favor?
Roll call.
Roll call requested, roll call granted. Ms. Johnson, please take the roll.
Chair Rosen,
Chair votes no.
Vice Chair Ingebrigtsen,
No.
Senator Marty,
Aye.
Senator Benson,
No.
Senator Champion,
Aye.
Senator Johnson,
No.
Senator Kent,
Aye.
Senator Kiffmeyer,
No.
Senator Lopez Franzen, Senator Pratt.
There being 4 ayes and 5 noes, the motion does not prevail. And back
Madam
to
Chair, I
Senator.
renew my motion.
Senator Ingebrigtsen renews his motion that Senate File 4410 be amended to include the contents of Senate File 4198 as amended, and that staff be instructed to make necessary technical and conforming changes. All those in favor, please say aye.
Aye.
All those opposed, nay.
No.
Motion prevails. Senator Ingebrigtsen.
Madam Chair, I move that Senate File 4410 as amended be recommended to pass and place on general orders.
On that motion, all those in favor say aye.
Aye.
All those opposed, no.
No.
The motion prevails. Senator
Thank you,
Abeler,
Madam Chair,
thank you very
members.
much. You
Very
worked
much obliged.
extremely hard, you and your committee, and really appreciate your passion.
Yeah,
And
they're rock stars.
yeah, and the staff, you guys did an amazing job. So, really appreciate it. Thank you. Okay, with that, let's see. We're done. But we got a few more things to come in next week. With that, members, it looks like we are done for the day with our big omnibus bills, and we have a few more bills coming through, of course. One is the mental health bill, and we're going to do still a hearing on the We're doing on, with the state director. Yeah, Mimi. Oh, IIJA, yeah. We're going to have a hearing on that, where the funding is going. So stay tuned, and thank you very much, everyone.
Madam
Senator
Chair,
Marty?
do you have any idea what days these hearings are going to be
Probably Tuesday, Wednesday, or Thursday in the morning
of next week?
of next week, right. Okay, sounds good. Thank you very much. Meeting is adjourned.